Meeting to order. Lily, do we have any public members on board yet?
Yes, we do.
Okay, do I have any public comment on items that are not on the agenda? Hearing none, we will go to the 3A, approval of minutes. Do I have any committee comment on the minutes?
There's a quick correction on Lloyd's part. The word proceeds is spelled differently. If it could just, it's a minor spelling error.
I'm sorry, Commissioner Allman. Do you know what page that's on really quick?
I'm sorry. I don't have my agenda in front of me. It's on a computer, but it's under Lloyd Weir's presentation about the proceeds that we have, and it's 15% less than expected. And there's a misspelled word there.
Okay.
Thanks.
Did you catch that, Allison? Commissioner Riley.
Thank you. On item 3E, which was the discussion regarding the contracting or consulting contract with Sally Riley, I feel like the discussion should reflect that there were at least 3 members that requested that itemized invoices from the consultant be included in the regular financial report. And there's something about that in the motion, but I don't think it's clear. And that was a clear direction in the motion, is that we wanted to see itemized invoices attached on a regular basis, please.
Do you have that correction, Allison? Okay, any further committee comment? Any community comment? Hearing none, can I have a motion to accept the minutes as amended?
I so move.
I'll
Allman.
second.
I'm sorry, a second?
I think Member
Second.
Allman beat me to it.
Okay.
Okay.
All those in favor?
Aye.
Aye.
Commissioner
Aye.
Ware? Commissioner Ware, for or against? Commissioner Barish, for or against?
For.
Commissioner Myrtle, for or against?
For.
Commissioner Ross, for or against?
For.
Commissioner Ware, do you want to weigh in? You're muted, just in case you know. Well, it passes with Commissioner Ware not being able to vote. So we move on to item B. Discussion and possible action regarding expenditure report on Measure B tax funds, etc. Commissioner Weir. And you need to unmute, Commissioner. Lillian, are we having problems with Commissioner Weir's connection?
Sorry, yes, I was just on the phone with him. I am right. He's one of the call-in users. He called me and let me know it was him. He should be able to speak now. He's unmuted.
Commissioner Ware? He still shows muted on my screen, Lily.
Yeah, he's unmuted on my end. He's probably muted on his end.
Commissioner Ware, if you are muted, if you are muted, you need to press *6 to unmute your phone. There he is, he's connecting.
Donna, while he's working this out, can we move on to the next item? I think it's gonna be a very full agenda today.
Yes, it is going to be a full agenda. I'm going to give him about 10 seconds to get on, because usually when you're connecting to audio, you should connect right straight on. But he is having issues. And I concur. Lily, can you
Can
help
you hear me?
out? Oh, wait, Lloyd, are you there?
I'm here. Can you hear me?
Yeah, we can hear you.
Okay,
Yes.
I'm sorry for that. I'm trying to use the phone today, so.
It's up to you, Lloyd. We're on 3B.
Oh, okay. I'm on board, huh?
You're on board. You're up.
Okay. And we're going over the finance report, correct?
Yes, sir.
Join if you have.
All right, so looking at the report that's dated down at the bottom, 7/14/2020. I'm going to start at the top, would be our 2 years of revenue proceeds, Measure B sales tax proceeds. We now have a total of that April 2020 entry is 566,667. This is a reduction of 17% over last April's proceeds. So this is the third month in a row that the proceeds have been less than the previous year's month. So we're preparing for a reduction here, and we'll be talking a little later in the meeting about some projections, but they're going to include these kinds of reductions due to the COVID reactions. And we drop down to the expenses, life to date, 795,502. You can see I have the two bottom lines for expenses are the total ongoing costs of our two facilities. The first one is the training center. Total cost at the end of June so far is $33,557. The next one down is the crisis residential treatment facility design costs. So far this year it's at $224,468 of that total. Your life-to-date interest earnings are $252,735. So currently in the restricted fund for Measure B, we have a total of $16,538,483. And that's my report.
Thank you, Commissioner Ware. Do I have any committee comment, please? Yes, Commissioner Riley.
In the addendum that was sent out today, there's a copy of the Measure B budget. Is that intended to be discussed under this item or a separate item?
Sorry, that was,
I think that's a question for a separate item.
separate item. It was a request from Tom Allman during our last meeting, and not necessarily for discussion, but for reference.
Okay, is there an opportunity to discuss it during this meeting? Is that a separate agenda item?
That would be a separate agenda item. Everything is put out here for, and it should be on, we can do it on next month's agenda since we are finally starting to put a budget together. And if you have any comment though, you can say it now.
Well, I guess I would like clarification on a few of the line items. So maybe I can just list what those are and we could get more details at the next meeting. Would that be appropriate?
Perfect. You can do a list now, or you can email it to Allison and get it taken, and we'll get it taken care of.
Okay. There's just 3 items, really. I'd like to understand what special department expenses are. I'd like to understand the need for travel out of county. And then I'd like detail on the operational transfers out under expenses. We have over $2.7 million listed as expenses for this upcoming or this current fiscal year, but there's no detail or indication of what those expenses are. So those are the things I'd like more information on for the next meeting, please.
Perfect. Commissioner Ware and Commissioner, and Allison, do you have those listed?
I do. Thank you.
Thank you.
Any other further committee comment? Any community comment?
Well, I was going to weigh in. I'm sorry.
Sorry.
Unmuted, but
Sorry,
you
Commissioner.
know, our budget is very important, and honestly, there shouldn't be a need to put off a budget discussion for a month to get on the agenda. The budget is just as important as anything else. So my recommendation is that we have a consistent agenda item budget, so we don't have to put off questions. Shannon's questions are very good, and it seems almost silly to put off good questions for a month when the answers are available to us as soon as possible. An agenda item is to make decisions, and a simple discussion on the agenda is not a decision, it's merely a discussion. So those questions are reasonable questions, I believe, and there's no need to put them off for 4 weeks.
Correct. I would like to see, we can have a budget agenda item. If those answers are quick and ready to be given, Commissioner Weir, I'm fine with that. If they need to be spelled out more, they will be spelled out more next month. Commissioner Weir, do you have a quick answer?
Yeah, I think so. Can you hear me?
Yep.
Okay. Special departmental expense. That is where we get invoiced or billed from different county departments providing services to us. So an example of that would have been when the CEO's office was administrating and supporting the board. They would bill against this budget, and that would be the line item we pay out of. I set it at 100,000, not knowing at this point how many departments are going to need, to bill us for services. But that's just a starting point. And then I believe the big one down at the bottom, the operating transfers out, those are when we reimburse facilities for our construction costs and our design costs for our facilities. So we were anticipating cranking up on, the training center and the CRT and possibly the PHF. So 2.7 million was an estimate of what we may need to transfer these funds to help build our facilities. And I forget what the third one was, Shannon?
Thank you.
Out
The
of
third
travel.
one was travel out of county. I was just wondering why we needed travel out of county.
Yeah, that's kind of a placeholder. I wasn't sure if that is going to be a requirement of anybody to get the jobs done, but just as a starting point, I put some money in case we are traveling out of the county.
Thank you. May I ask why the special department expense is so much higher in this last fiscal year, 500,000 versus 100,000 going forward annually?
Yeah, so that was an estimate of the previous year's budget at 500,000. That never happened. So you can see that the actuals were zero in that, in 18-19. In 1920, it's just another guess at what we thought. We thought we were going to do a lot more in-county department charges, and it just ended up being either an invoice or an operating transfer out.
Does that answer your questions, Commissioner Riley?
Well, if I may, at what point will we have actuals for 2019-20?
Yeah, so we're in the middle of closing our year. We have a 60-day period now for accruals. So probably towards the end of August, we will have a final budget report to pass out.
Okay. I would like to request that as soon as that's available, we do receive that at the committee so that we have actuals. And then I don't have enough monitors here in front of me, so I only have a couple items up, but the monthly expense report that you provide for us, does that include itemization of the special department expenses that are billed to Measure B?
Yeah, that worksheet that I do, that one pager, that has everything that exists for cost. So part of that would be
Okay.
the special departmental expense.
Okay, thank you. Those are my questions for now. I appreciate the response.
Thank you. Any other further committee comment on that? And we
Chair-
will, I'm
Chair
sorry.
Muschetti, I've had my hand up.
I'm
I
sorry.
don't know if we're using this mechanism, you know, hand up, hand down. I'm not sure if we're using it, but I wanted to make a comment.
Yes, ma'am.
Thank you. So I appreciate the questions and I would also like the information. I think, though, I would like to say for Commissioner Weir that I believe that certainly the budget probably is a little higher than what the actuals are, which you've already shown. But I believe that the example for special department expense, my recollection is that the sheriff's office and the executive office never charged Measure B. And Measure B was never charged for admin until Miss Bailey came on. And then before that, actually, Miss Gonzalez. And then their time, of course, their salaries were charged. But I'm not sure this is the line item that they were charged. So what could be in the special department expense could be some of the supporting services for Allison as far as the projects. But, you know, for the purpose of the public, I'd like to be clear that the sheriff's office and the executive office, I don't believe we ever charged Measure B a dime, which is why it was really important for Measure B to have their own staff at some point. So I just wanted to make that clarification, and certainly when the itemized statement comes out, we'll see that. And I could be wrong, but that was my recollection. So thank you.
Thank you, Commissioner Angelo. And to my recollection, that is also true that the sheriff's office and the CEO's office absorbed the costs for the first 2 years. Any further on the budget? Any community comment?
Yes, it looks like Sherry has her hand raised. Sherry, you're unmuted now.
Sherry, please state your name. You're still muted on your phone. There you
My
go.
name is Sherry Ebiam. Can you hear me?
Yes, ma'am.
Okay, great. Yeah, I had just a little bit more, another question related to the special department expense. I see the only thing that was actually charged was in 2017-18, and that was for the election costs. And other than that, I mean, we have a detail from Mr. Weir's presentation of all the expenses. And I'm wondering, going forward, you know, $100,000 is a fair amount to budget in there. I'm wondering what types of expenses are expected to come out of there, since there's now Measure B staff to handle stuff. So that's my question. Because, yeah, Sarah Riley is in a different category. she wouldn't come out of this. And I don't think Nash Gonzalez would come out of this. So, yeah, I don't know how much Sarah Riley's total of the total expenses to date are 263,000. 161,000 was for the election. That leaves 100,000, and 23,000 of that was for the Kemper report. And except for Riley and Gonzalez, everything else is really small expenses. So I'm just wondering what supports a number like that. That's all.
Thank you, Sherry. Any other further community comment? Hearing none, we will move on to item 3C, which is the Kemper ad hoc, which has sort of formed into also the gap analysis. So in the last month from June 24th, I believe, to today, the Behavioral Health Advisory Board, NAMI, and the County Behavioral Health has met twice. In our first meeting, we talked about gaps. In our second meeting, we prioritized. Everything that is in, you all should have received the Measure B program funding suggestions. Everything that is in there went by both boards, the Behavioral Health Advisory Board and the NAMI board, which approved these Measure B program funding suggestions. And so we are, and they all fit in with the Kemper report, and that's why we put them under here. Every single recommendation is under the Kemper report, and I would like to turn it over to Dr. Miller, please.
All right, thank you. Good afternoon. So I'm going to go through just a little bit of the programs that we are proposing. As Donna said, this was a collaboration between the mental health agencies, sort of within the county. I can say that the Behavioral Health Advisory Board has spent the last couple of years really looking at service gaps to really figure out what we could do differently and how we can serve those individuals. And so it was actually very timely to combine and come together as a collaboration, because NAMI also has had their own look at service gaps, as has the department. So one of the things you'll see in here, one of the first items I'm going to address is the housing. We know that we don't have enough housing within Mendocino County. We know that the Housing First model is nationally recognized, and that we know within our different organizations, it's one of the first things that our different organizations advocate for, is that we need to house our individuals. Housing is a prevention, early intervention. It is really hard for us to help people find recovery when they are not housed. There are a lot of things that happens to our clients if they don't have housing. One of the things that really stands out is that they're often taken advantage of. Their medication, we get them started on medication, they lose their medication, their medication is stolen from them. It's very common when we have clients on certain medications that they are beat up, or their stuff has gone through because people want those medications so they can sell them or use them themselves. So we know the first step to recovery for anybody who has a mental health disorder, especially those with a serious mental health condition, that housing is a first priority. So that was one of the first things we talked about as a group. We need more housing. We would like these housing dollars to be a one-time, and really we want this housing to focus on the coast. We have a couple housing complexes here in the inland area, and we need some mental health housing on the coast that could really serve that population and that community. The next thing we really focused on is community education, awareness, and support. One of the biggest things that we know across the country is stigma and discrimination is a huge factor for why people don't go and get services, right? No one wants to be mentally ill. If you say you have cancer, the world has empathy for you and wants to be there to support you. You say you have a loved one who's mentally ill, or that you have a mental health condition, and all of a sudden you are you have the plague. Nobody wants to talk to you. People can't understand you. There's something wrong with you. And so often I get asked, why do people not go and get treatment? Why would they get treatment if they're worried about being discriminated and stigmatized, right? Why do they stop medication? Because of the stigma and discrimination. I won't say that's 100%. I mean, some of it is the side effects of medication. We know that. But there is so much stigma and discrimination. Nobody wants to admit to having a mental health issue. We really want to focus better in our community on stigma and discrimination. We need to reduce that. But this also is about educating our providers, any provider that we have within our community, whether it's the ERs, the physicians, the first responders, doing better education about mental health, how to work with people that are mentally ill. And then we also see this as one of the prime things, one of the things we hear over and over and over, and I can tell you for 13 plus years, I've heard the same question. How do I access services? What services do I access and how do I get into those services? We really feel if we had kind of a universal resource like this, people would have a one-stop shop to be able to get the education, their needs, but also be able to access services by calling a number and saying, okay, this is your insurance, this is what you're looking at, here's the different providers within your area. That seems to be a common problem. And I would tell you the Behavioral Health Advisory Board, we spent last year creating these amazing flow charts to get out to the community on how to access services, but that's only one tool. And there's still questions about what system do I belong to and how do I access services. We also want to get family members and clients the support they need. What happens when your client's diagnosed? Where is that support? What is that door? What do you do? We really feel that this type of outreach, education, and support would be pivotal to our community and to allow people to get the services they need. Next, we looked at aftercare. As you know, I brought this up before. One of the things we know, one of the big disadvantages we see when we hospitalize individuals in a psychiatric facility is we bring them back and there's not aftercare. If you're indigent or have Medi-Cal, you can get aftercare because you fall within the county system of care. If you have veterans insurance, Medicare, private insurance, there's no guarantee that you're going to get followed up. There's no guarantee you're going to get your prescription filled. There's nothing offered. One of the things the state of California has done for the last couple of years is really monitor whether or not aftercare is provided to Medi-Cal clients. They're doing that because they know that it reduces people going back into the facility, right? They know that the stats have shown that if we're offering an exit interview, which we do as soon as they leave within 48 hours after they're discharged from the hospital, and we're getting them connected to services and we're making sure that they get their medication, that they're less likely to be readmitted into a facility. Unfortunately, you don't see that across the system of insurance care. You only see that in the Medi-Cal and indigent side, and it's something that the state tracks so that we can see how are we doing and our readmission rates. And we've been able to show that the readmission rates by offering aftercare has reduced. We are proposing that we put some money in to provide aftercare to all individuals who get hospitalized, that we work to make sure we track those results to see is it beneficial and be able to work with the private insurance companies and the Veterans Affair in our area to say, we would like to see you guys put money into this so that we'll have the outcomes to show why it's beneficial and how it actually is cost effective. One, for their insurance companies, because they're not willing to do it right now, but also just the benefit of the client to make sure they're connected, they're getting medications, and they're not getting readmitted into a psychiatric facility. The next thing we talked about was mobile crisis teams. We know this is a national thing. There's a national movement for NAMI. Behavioral Health Advisory Board has really been wanting to see this differently. And so I have in a conversation with Sheriff Kendall, he has a Butte County model. I've come from a couple different county models of worked with other counties that had. I spent time during my doctorate program in the city and county of San Francisco doing mobile crisis, actually working on the team. So I come from that experience. We would like to do this as a pilot project. I know there are some other options out there. We really think that this is the rural part of our community doesn't have crisis easily available within their cities. We'd like to pilot this, see if it's effective. It really is a movement to having a mental health worker and the sheriff deputy together going out on calls to see the effectiveness of hopefully reducing the need to have someone need to be placed on a 5150, making sure those that are placed on a 5150 will meet criteria to be placed. As you know, sometimes they get to the ER and then they're assessed and they have to be, they're sent home. And we want to reduce that. If we can serve them in the home, let's serve them in the home, and reduce the number of calls that the law enforcement may have to go out on, and reduce the impact on the client from ending up in the ER, sitting there for 6 to 8 hours, and then ending up needing to go back home. Sometimes they have a ride, sometimes they don't. We really think this model would be a good pilot project to see how it works within Mendocino County. We also put in here our 2 facilities. We are looking at crisis residential treatment facility. We think that's a valuable need in our community. It really does do 2 things. It can reduce the number of individuals needing to go into a psychiatric health facility. It also allows for a discharge plan. So it'll give someone to ability to discharge to a place if they're not able to go home right away, or they need further stabilization, which will also reduce the number of readmissions, or reduce the number of people going into that higher level of care. We honestly, the highest level of care is not where we want to see most people. We want to see that for those who need it, and that's no alternative. None of us like to go to the hospital, so I can imagine, most of us can probably imagine what it's like to be put into a locked facility and feel like your rights have been taken away. We can restore some dignity by having some of these different options within our community. I did propose in this, my real proposal is that these facilities operate themselves and are able to fund themselves based on billing the different types of insurance. But in this proposal, because there's been a lot of conversation about whether a facility like this could run itself, we went ahead and added in what we proposed would be about $500,000 a year if they billed the minimum number of Medi-Cal hours they could bill. And so that gives you kind of a look at what we thought. If we added an extra $500,000, that kind of gave us a soft landing if we needed to put any dollars in based from Measure B. The next we looked at was a psychiatric health facility. We do see this as a viable option if we do a regional model, and we really work with other counties. As I've stated before, I have spoke with Lake County. Of course, they're interested. There's never enough beds in the state of California, and as long as we have a Medi-Cal facility that takes the ages 21 through 64 and can bill Medi-Cal, that would benefit our community. We are proposing that, as a lot of other private entities out there, that this could operate itself by billing insurance, which is commonly done through multiple private companies that do it currently, and we would not need to put any Measure B dollars into that facility to operate it long term. Just putting some dollars in to construct it or renovate a facility for it. The last page of this proposal really does look at if we funded all of those programs that we proposed over a 4-year, which is what we're saying, let's fund these for 4 years. We also would work with those entities to look at alternative funding sources, grants, other billing options, that knowing at the 4th year, they would, after 4 years, they need to be able to fund themselves. You will still see that based on Lloyd's projections, we still have about $5 million in operating service costs that will be sitting there not spent. And so that is all I have to add right now. I know Sheriff Kendall is on the line, and he may want to add something regarding the mobile crisis.
Okay, thank you, Dr. Miller. We are going to take this as a committee one by one. So the ad hoc committee is recommending on the first one for housing, $1.3 million to purchase and or renovate or build permanent housing for individuals on the coast that are homeless, etc. Do I have committee comment, please? Riley, Commissioner Riley.
Thank you. Big proponent of housing here. I spend a lot of my time and energy with the city of Ukiah helping developing housing of all types within our jurisdiction. So I do have a lot of firsthand information about various sources of funding for housing. My concern about this is not for the need for housing, but the fact that there are so many other sources of funding. My concern is allocating Measure B money, which is unique. It's very difficult to obtain specified money for mental health services and facilities like we have here. I think we're probably still unique in the state of California in that effort. Whereas for housing, particularly for acquisition, rehabilitation, development of housing, we have money, we've got home grants, we've got CDBG funding. There's a new project Home Key with billions of dollars available. There are so many other sources of funding that I think could be directed towards this. And then secondly, no supportive housing like this can be developed effectively without the services that go with it. And so we have a very successful project here in Ukiah, Willow Terrace, which is managed by RCHDC and some other community partners. But it's much more than just building housing. Those support services are absolutely critical. So I would want to understand if we have the capacity for additional support services in this county, and if there is a managing partner. But more importantly, I think there are more sources of funding for housing than Measure B.
Muted. Thank you, Commissioner Riley. Anyone else? Commissioner Allman.
Well, it was my intention when this language was written that Measure B monies would be used for matching grants. So I think that hopefully there's a way to marry these two ideas together to where both what Shannon is suggesting and what Dr. Miller has suggested is possible, and Measure B dollars, which are a rarity in California, would allow us to use our matching grants without having to go to the general fund. So I would imagine that what the governor has proposed for housing and what we're seeing some at the federal government is going to require some bit of matching grants, and we're there. We're already ready to do it. So that's my take.
Thank you, Commissioner Allman. Any other, Commissioner Diamond?
I think everybody knows, my area of expertise, if I have any, is in services, and so I'm pleased that we're addressing services. My concern about just services in general, all the items on this list that you've given, other than the last two, which we've talked a lot about in the time we've been meeting, which are for the residential kinds of programs. My question just generally to the group is this is the first time, at least the last couple of meetings, that we've actually talked about services separate from the services that we have talked quite a bit about being provided in a crisis residential facility or a PUP type unit. So my question, just of all the services that you've recommended, is the reason that you're recommending them now because it's taken so long to get services tied to the residential programs, which is a concern that I had. I may have naively thought that when we talked about getting a PUF unit or getting a crisis residential, that would have happened a lot sooner than this. So I'm wondering if your feeling is that it's taken so long, we really need to get some additional services available to people, which I feel some leaning towards. And we talked last couple of times that because of the COVID issues, there's a need for additional services, but we're also recognizing that we may have some additional cuts in the amount of money that we thought we might have available. So I guess my just overall question to whoever is speaking for the group, why now? Why do you feel this is important now that we address these needs for additional services in addition to the residential services that are attached to the building facility?
Dr. Miller?
So I would just, so Jed, in response to your question, I think we've always thought these were important services, so I don't want to say that they're just coming now. I think that there's been a lot of questions about how Measure B dollars would or would not be spent and whether or not they really needed to be reserved for the residential facilities. Without us doing the thorough analysis, I think that we've done the thorough analysis and we can say that we can fund alternative services. It doesn't have to be one or the other. It can be both. And I think that's why we're bringing it now. Commissioner Allman also asked that the different entities bring some services forward. And so we felt it was time to do that and that maybe we were ready to make decisions on that we could spend some Measure B dollars outside of just holding them for these facilities, that we could actually make some movement and add some great services to our community. And yes, we need them even more with COVID today.
Thank you. Just one additional question I think you can answer, which is the money part of this is generally not my area of expertise. So I have to trust the people on the committee that are more knowledgeable to say, can we afford it? And I guess I just ask you all who are more skilled in the actual funding that you've recommended, and can we afford it? Is this going to be, we're going to have the money to pay for these if we recommend them. Could you give me some assurance on that?
So yes, that's why I did the budget at the back, is to really show, here's what we're recommending, here's what we're bringing in, and we still have $5 million that we will not have spent after we funded these programs. So yes, we can afford these.
Great, thank you.
Thank you, Commissioner Diamond. Anybody else? Commissioner Mika.
Yeah, so I had when this got brought to the BHAB board, I had kind of the same thing. How does housing come into Measure B? And the explanation that it's the early education and prevention component that the Kemper report really recommends made sense to me. And I like Almond's idea of trying to marry the two, because as Riley was saying, there is some other source of funding, but we're always short on housing. I mean, if there is so much funding available, why are we so short? So if Measure B decides that's really one of the priorities that we want to take on, then maybe we can get that matching funds to really do the housing, because you're going to have to support the aftercare issues as well with whatever facility we have. So that's why I think the measure, or the BHAB really supported this and thought that it could be a component of Measure B.
Thank you, Commissioner. Any further comment?
Yeah, it's Mark. I've had my hand up, but I don't think anybody's looking at the hands over there. But anyway, I'll just chime in. Is this money specifically geared towards something? Is it planning to be matched with other funds? Because $1.3 million isn't going to really do much for the housing crisis. Housing on the coast is $400,000 for a single family residence. So that's 3 residences. So if this were to go with some type of development like you've done in Ukiah, where you have 2 to 3 sources and it's $5 million, then I think we'd make an impact in that. Is this money that's just being earmarked for housing and waiting for other stuff, or is this going into a specific use that you see right now?
So I wouldn't say that we have a specific use right this second. I would say our plan is to look at other possible funding options that are out there, to also look on whether there are some tax credits we can get. That's usually how we've used the funds. So all the facilities we have built, and we have a couple, start with a seed dollar, right? Start with $1 million or $2 million. And then we work with local entities to see, can we get additional grants? Can we get tax credits? What do we do? Which has allowed us to build the facilities we've built today. We didn't build Willow Terrace with all the dollars up front. We built Willow Terrace based on the fact that we got some Mental Health Service Act dollars given to the county. We then took those and were able to work with different entities to expand that dollar amount and to build that 38 apartment complex unit. So it's a seed to start and look at, what can we do? How can we match it? How can we expand it? What are our options out there? But a lot of times, without having that seed to start with, you're not always going to get people to buy in, to add, to do tax credits and that additional stuff.
Thank you.
Sorry. Anybody else from the committee want to? Yes, Commissioner Allman.
Thank you very much. And I really want to thank Dr. Miller for this. This is probably one of the biggest and most productive meetings we've had since Measure B has started. And I certainly support this. And I think that thinking of the coast right now and taking a first step towards the coast is a huge step of telling the public that we're not just meeting for the sake of meeting, but we're actually using our monies for a tangible solution of this. And I know that Sheriff Kendall's on the line. He's ready to talk, but and it may be about the Butte County thing, but he might want to weigh in on this. And he sent me a text, said, how do I get in? So I think he's available.
Well, my problem is technology. I can't quite find the right button to push. No, I wanted to speak just a little bit about the Butte County model, but also I think that this is absolutely the right step, because then we're actually taking tangible steps. The Butte County model to me is very exciting. I've discussed it at great length with Dr. Miller. Some of the data speaks for itself.
Sheriff
Yeah.
Kendall? I'm sorry, I hate to be rude, but
Go ahead, be rude.
we're on the housing right now.
Oh, okay.
So how do you feel about that?
Well, I think it's a step in the right direction, because we're actually getting something done. And whatever we can do to take these first steps to get that in line, then we can take the next steps to continue on with the service.
Thank you, Sheriff. Do I have any other committee comment? Yes, Commissioner Riley. You muted yourself.
Sorry. I agree, and I appreciate the need for matching funds in some cases. I'm going to reiterate my opinion that I think Measure B funds should only be used as a last resort for this, because there are literally so many other sources of funding for housing right now. And this needs to be a conversation with the jurisdictions as well. The city of Ukiah has consistently met or exceeded all of the state's mandates for housing. We're doing that on a regular basis. I know that there are issues in the county with developing housing that related to rezoning land and things like that. But this type of housing needs to be developed within close proximity to services, employment centers, etc. So you're not going to build a supportive housing complex for homeless or potentially homeless people out in the boondocks. It's not going to happen. That's not appropriate. They need to be close to transportation, everything else. So the jurisdictions absolutely need to be a part of this conversation. And I think Measure B funds should be used for housing as a last resort. Instead, they might help provide services to said housing. So that's my 2 cents on that.
Thank you. So any other further community comment? I mean, excuse me, committee comment. Sorry.
I don't know how to raise my hand on this thing. How do you do that?
I can't see, Ross, so I'm sorry. Go ahead.
So anyways, I think that I actually agree with Dr. Miller's assessment that we need more housing. We need more housing just generally, and obviously for mental health clients. But you know, I think it was 5 months ago, this committee reached out and was seeking some advice on how to provide services to folks to fill those gaps. And I'm happy to see that there's some response on that. And we're also looking, 5 months ago, I think it was, we were also looking for specifics as to, you know, what the gaps are, service gaps, and then how to fill them. You know, the voter mandate was a minimum of 25% was spent on services, and the Kemper report indicated that we could probably reduce the people that get into crisis by 20 or by 50% if we did a better job on services, which would be a huge step forward. So I'm you know, happy they're looking at housing for all kinds of reasons, but also I think that the notion that, you know, we need to provide services is important, and I still want to move forward on what we voted to act on 5 months ago, and that is, you know, how do we identify those gaps, and who can help us fill those gaps? Who can we fund that would help fill those gaps? And I really don't know if I got an answer to that. And I think you were talking about MOPS. Do I have that right, Dr. Miller?
Which gaps would be the
Well, you
question?
were
I have.
talking about, I thought you were talking about going out, reaching out to these people, the clients, and where to make sure they take their medication. And it sounded much like the MOPS that over a year ago, we voted to ask for $460,000 in funding, and yet it never happened. And one of the problems, one of the problems I think that we've got as a committee is all with good intentions, we deliberate, we contemplate, we ultimately vote to move something forward. And frankly, if there isn't a consultant in the loop, then nothing goes, because we all have day jobs, and I think it sort of gets lost. MOPS is a good example of that. It went 6 months before Commissioner Riley and myself asked whatever happened with it. So I wanted that, what we asked 5 months ago was, is there gaps? Who can help us fill those gaps if we fund them? And this is kind of the first thing that's actually happened on that. I just don't want to let it go. So thanks for your information, and supportive of housing, and specifically supportive of filling those gaps still.
Thank you, Commissioner Liberty. Dr. Miller?
Yeah, just really quick, I wanted to add, just because there's been a couple comments. So I want to make sure that if we build mental health housing, the support services will be there and they will be provided. The benefit about the support services, and why I'm not saying today we need to fund support services, is because most of those support services are Medi-Cal billable services. So if the individual is especially a mental health client and is getting services through the county, most of the services that we provide, which is why we're able to provide them at Willow Terrace, it's not the set aside dollars that came with Willow Terrace. That's not the reason we provide these services. It's because through the Mental Health Services Act and through Medi-Cal dollars, we are able to provide those services and receive funding for them. So that's why you don't see a service component specifically in this, is because we can bill Medi-Cal for that. We don't want Measure B to pay for anything we can bill Medi-Cal for. That's not a good use of the dollars. We want Measure B to pay for things we, and especially mental health, that our community needs cannot be paid for through Medi-Cal or Mental Health Services Act dollars.
Thank you, Commissioner Miller. Last chance for committee comment. Community comment, please. I know I have somebody who wants committee.
Yes, we have Jan McGordy. She's unmuted now.
Miss McGordy? Are you there? You need to unmute yourself. Star 6. There you are.
Am I here?
You're here.
Okay, thank you. Hello, everybody. I missed you guys. So I just wanted to respond to Jed Diamond's comment about why we haven't looked at service gaps in the past, and note that when I served on your committee, on your advisory board, and we had an ad hoc committee for the Kemper report, we were forbidden to talk about services. So now you're wondering why this is only coming up now. That is why, because the Measure B committee refused to let us talk about services. So also, I mean, I have a lot to say about these things. I know we're talking about housing right now, which I agree is the first and most important thing for people who are suffering from mental illness, is that to have some kind of stability so that they can, you know, keep themselves clean, take their meds, have a home, cook. However, I just wanted to mention that the Kemper report that was enacted at the recommendation of the Behavioral Health Advisory Board listed out a lot of these things. Measure B didn't act on our report. We did, on Measure B, recommend to the Board of Supervisors that MOPS be increased, which was also a recommendation by the Behavioral Health Advisory Board, but it was the Board of Supervisors that did not approve that. So that's all I want to say on this part of your discussion.
Thank you, Ms. McGordy. Anybody, any further community comment? Lily, I can't, oh, Sherry, does Sherry want to speak, Lily?
Yes, she's unmuted now.
Oh, there you are, Sherry.
Hi, thank you. I just had a question on the Measure B, revenue versus expenditure versus expense projections. It's the page just before all of this breakdown. And I see a budget, a projection for the crisis residential treatment and the PUF unit, but I don't see a line for the crisis stabilization unit. In the Kemper report, all three of those facilities were listed. And in the Kemper report, the cost for the PUF unit was 15 million, which matches this printout exactly.
Yeah, Sherry, I'm
Yeah.
sorry. I'm sorry to say, we're talking about the housing right now. And
Okay.
we have to stay on topic. So do you have anything to say about the housing recommendation?
Nope, I don't.
Thank you. Any other further community comment? Hearing none, we have a recommendation on the floor from an ad hoc committee. I would like to take a vote if we can, please. The recommendation, unless someone wants to change it, is that we put 1.3 million to purchase and or renovate or build permanent housing for individuals on the coast that are homeless, chronically homeless, or at the risk of chronic homelessness who have a mental health condition.
And the motion should be that we recommend to the Board of Supervisors that they put that. Yeah.
Correct. Thank you, Commissioner Ullman. I'm sorry. We add that we recommend to the Board of Supervisors. Thank you for that correction. Allison, can you please call for a vote?
What's the motion? What's the motion?
Yeah, no one made a motion.
From the ad hoc committee, which acts as a motion and a second, is that we recommend to the Board of Supervisors that Measure B allocate that Measure B has a one-time allocation of $1.3 million to purchase, renovate, or build permanent housing for individuals on the coast that are homeless, chronically homeless, or at risk of chronic homelessness who have a mental health condition.
Point of order, if I may.
Yes.
I don't believe that a recommendation from an outside committee serves as a motion and a second. If I could get clarification from County Council on that.
Christian, please.
I don't know that there's anything in the bylaws that would make it a motion per se. I would suggest that the chair entertain a motion from the committee.
Perfect. I was shortcutting. So I would like a recommendation from the floor, please. Commissioner Diamond.
Yes, I would move that we make a motion to accept the recommendations as described.
I'll second that.
Thank you. And do you have the wording, Allison, so that the committee knows exactly what it states?
Same. I have a recommendation to the Board of Supervisors that Measure B, has a one-time ask to allocate $1.3 million for housing on the coast, which is for renovating, building, or, gosh, I can't read my own writing. But for renovating
permanent housing for individuals on the coast that are homeless, chronically homeless, or at the risk of chronic homelessness who have a mental health condition.
Yes.
Do I have a second?
Ika.
I thought I second that.
Oh, I'm sorry.
Yeah. I have Sarah for a second.
Perfect. And will you call off a vote, please?
Yes, ma'am. Okay.
Can we have some more discussion on that? Yeah, that I think that deserves a little more discussion. Chair?
Yes, go ahead.
So I'm supportive of it, but I would say that not building. Building would mean it would be prevailing wage. Building is incredibly expensive right now. Every builder is flat out. I would not be supportive of that.
It also states renovation. So we're covering all our bases, Commissioner Liberty.
I get that, but if it's got building in it, I'm not supportive. I just think that it's just too expensive to build right now. It would be, it's even expensive, especially on the coast, to just purchase and buy something to renovate, but it's brutal trying to get something built over there right now. I mean, ask Mark. Mark would know better than me.
Thank you. Do I have any other commissioner comment?
Yeah, this is Lloyd. Can you hear me?
Yes, Commissioner Ware.
So the word the coast, is that we really want to focus this money totally on the coast, and that inland is all okay for housing, or is that going to come at a later date? Or
Commissioner Miller?
So so yes, we are focusing it all on the coast. As you know, we just built a 38 apartment complex in Ukiah. We have we have 7 housing complexes for those that have a special mental health condition in the Ukiah area, in the inland area. And we are in the process. We were able to get some No Place Like Home dollars, which we are building another complex with RCHDC, and 19 of those units will be also for specially mental health clients. So we have really focused on the inland area, and this is the time we really feel we need to focus on the coastal area.
Thank you.
Further questions from the committee?
Yes, could I ask?
Dr. Barish, yes.
Yes, so I'm just a little, I heard Shannon say that there were a lot of funding sources that Measure B didn't have to use dollars, their dollars that are earmarked for so many other things. And I'd like to understand, if that's the case, why are we doing this? And I'd just like to hear more comment about that.
Commissioner Miller?
I can't speak to any of all the earmarked dollars. That's not my specialty, but I can say that in the mental health arena, I wouldn't say we have a lot of earmarked dollars for especially mental health focus specifically. The dollars that we do have, we have been putting up and building housing. I would say it won't matter how many grants there are out there, we will never have enough housing for everybody. The benefit of building specifically special mental health housing, a lot of times the dollars out there are not for specially mental health focuses. It really does benefit our clientele to have housing together and in a place where everyone has a mental health condition. So it reduces the stigma and discrimination. Some of our clients do well in general housing, but we also know that they do 10 times better when they're in complexes that are really, everyone around them has a special mental health condition. So right now, what's on the table for special mental health, we have applied for all of those, and we are in the process, and we have processes going in programs. We're in the process of building inland on those.
Thank you. Any further, Commissioner Riley?
Question for Dr. Miller, if I may. So right now, the notice of funding availability has been released for Project Home Key. There's billions of dollars available. And I know the county is planning on applying, and these funds are intended specifically to be deployed in the immediate future, and are specifically for the purchase and rehabilitation of existing properties like old motels or old apartment complexes. Can you provide any additional information about what the county is intending to apply for, and whether this is perhaps a good fit, this type of housing that you're suggesting is perhaps a good fit for Project Home Key?
So I'm gonna see if Carmel Angelo can provide feedback on where the county is. I cannot provide that feedback specific to that project. I would say the benefit of having especially mental health people have their own facilities is still, I'm going to still emphasize, a lot of times with these other fundings, it's open to a variety of clientele, not just a specialty clientele.
Commissioner Angelo, do you have any comment?
Thank you. Yes, in response to Commissioner Riley's questions, yes, Mendocino County is looking at multiple funding streams right now, and we will be applying. I can't tell you what we're applying for right now, and I can't tell you the time frame.
Any further committee comment? Any community comment? Lily, do I have anybody?
No. Or yes, you do now. Sherry.
Sherry,
go ahead.
Yes, I just wanted, you said that, you know, what was I saying have anything to do with housing? And it does, only in the sense that there's a cost component to this of the 1.3 million. And I didn't see the crisis stabilization unit in the original breakdown. So I wonder how those will coexist.
thank you, Sherry. Any other community comment? Lily?
Jan McGordy.
I'm sorry?
Jan McGordy.
Miss McGordy.
Jan, you're unmuted.
Yes, I was just wondering if you'd like to include in your motion that matching funds be a part of the requirement for possibly using this money.
Yes. Yeah.
Thank you. Do I have any further comment? Mika, did you want to speak?
Yeah, I'd like to take that suggestion of the matching funds.
Allison, please refresh my memory. Who made the motion?
Let's see, Jed made the motion.
Is the committee okay with amending that? Jed, would you like to amend your motion?
I'm certainly happy to, but I'd just like to say that my sense is, for me, and the reason I made the motion is to trust there's 11 of us, there's a lot of us trying to make decisions. I feel like we need to trust the people that have spent the time, have looked into it, and I'm assuming that Janine and the other people are going to look at those things. I mean, that makes sense. I don't feel like I've got to add everything to that. I'm sure they'll look for every possible way to be sure it's serving the people we want. If there's other ways to get the money, they'll do that. I just assume they're going to do that. So I don't think we need to add those kind of things. I'm assuming that's inherent in the motion. Am I right, Janine?
Your motion stands.
That's my feeling.
Okay, any further comment? Allison, call for a vote, please.
Okay, Member Ullman,
Aye.
Member Barish,
Yes.
Member Myrtle,
Yes.
Member Weir,
Yes.
Dr. Miller,
Yes.
Chair Muschetti,
Yes.
Vice Chair Diamond,
Yes.
Member Riley,
I'm voting no on this, not because I'm opposed to housing, but because I'm concerned about reserving these funds for some of the other projects that have been recommended.
Member Liberty,
I'm with Shannon, I'm voting no.
Member Angelo,
Yes.
and Member Ferretta.
Yes.
Okay, thank you. On to number 2, community education, awareness and support. Dr. Miller.
Did you want me to go through it again? So we,
Just a refresher.
All right, so we are making a recommendation that we fund a organization to at $350,000 a year to do community education, awareness, and support. And like I said before, this is a huge need in our community. We see other communities that have this. You'll see in other communities, their NAMI organizations really run these for them and provide some amazing services. This would be a huge benefit to every community member to have this support and then have the ability to really have an agency out there educating providers, physicians, ERs. It's a much needed support both from the community, family member, client level, all the way up to the agencies within our community.
Thank you. Do I have any commissioner comment, please? Jed.
Yeah, I just wanted to be clear. Do you have an organization in mind that would do this?
I do have an organization in mind.
Okay, can you say what it is?
Yes, if it was up to me, I would be contracting with Mendocino County NAMI to do this.
Training center that we funded, would this dovetail with that? Would this be a separate thing, or would they work together, or do you see this as being kind of two separate kinds of trainings that would go on?
No, I think it would definitely could work together. I think if they were providing trainings and educations where they were bringing in local people, yes, I could see them using the training center. They already do some of this, but this would be really expanding and doing stuff we currently don't have. So I think that the organization would definitely use the training center for some of this education and training.
Great, thank you.
Further community comment or committee comment, Ms. Riley?
Thank you. Somewhat related to Member Diamond's question. A couple of months ago, we established an ad hoc committee or tasked some of the members, at least, with helping to establish a curriculum that would be associated with the training facility to ensure that we were using this facility to its full potential. And so this proposal that is before us today was that, would this be part of that curriculum, or is this separate from that? And is that other action still happening?
So I see this as separate than that action. And I would say Allison has been working with the Training Center Committee and actually been working on her own to put together some curriculum. We are in the process and hopefully we'll have in the next couple months a business plan that focuses around the training center and actually looks at some different trainings we could bring in to benefit our community and a sort of a regional model of counties around us also.
Thank you.
Further committee comment? Mika?
Yeah, I mean, I think this is a great use, and I think NAMI is a great, the place that should do it. You know, psychoeducation is an important component of training everybody in the community. So NAMI's really, that's really what they do and give a lot of support. So I definitely, as being on the training center as well, you know, I would hope that NAMI would be able to use the training center to provide some of these trainings, but I think it would complement what we're trying to do nicely. So I like this action item.
Further community comment or community comment? Mr. Myrtle?
Hi, it's Mark. Yep. I see that NAMI does a lot of stuff nationally, I think state-wise. I think $350,000 being spent locally won't have the impact that it might be able to have if we put that into actual service provision. That's my personal opinion.
Thank you, Commissioner Myrtle. Anyone else? Is there community comment? Oh, sorry. Did I miss somebody? Allison?
Well, maybe it would be helpful to explain a little bit about how this is implemented and so the value in it, so that the committee and the public can understand better.
Yes. I agree, but Commissioner Mika, please.
Yeah, I just want to say, I think in our area that NAMI's probably underfunded. There's a lot that can be done with it. But I think, Donna, I mean, you've taken on the project in the last couple of years, but I don't think you have a lot of funding for that. So I think developing NAMI more in Mendocino County with this money and training is definitely something that's important.
Thank you. First of all, I want to state publicly that NAMI would have to put forward a business plan to do this. We would have to come up with how we're going to implement this. This is open to anyone, by the way. It is not just NAMI. We would have to come up with a business plan, a way to implement it, and any organization, not just NAMI, that applies for this only gets paid for what they do. So in other words, if Joe made a proposal and only put forth $50,000 worth of services, that's all that is billed to Measure B under this. So that's the one thing I want to make clear. Number two, this is open to anyone. NAMI is about fighting stigma and that, but we would have to come up with an absolute excellent business plan to even propose for this money. So I want to make sure everyone knows that. Any other further community comment or committee comment, excuse me?
Well, is that going to be in the motion then of what that I know that Dr. Miller said that she's thinking of NAMI, and then our NAMI representative, but you're saying that NAMI is going to have to basically put in an RFP just like everybody else. So I know we haven't had a motion yet, so the motion is going to have to be a little different than what the proposal was. If I hope you understand what I'm saying. So we do get the RFPs, and allow our mental health director to move forward. This doesn't need to come back to our committee, but it just needs to. If that's the way it's going to be handled, then there needs to be a good paper trail of it. Thank you.
Exactly. My personal thing is that it would go out to proposal, but that's because I'm also chair of NAMI and I'm chair of Measure B. So it's a conflict for me.
Yeah. So
if I could jump in, Madam Chair, I would suggest, frankly, just ending any further discussion of who might potentially get the contract. There are going to have to be some conflict issues we're going to have to look at, and just this sort of discussion, frankly, it's going to be more likely to cause problems than to help.
Perfect. I totally agree. And if this committee decides to go with this, it should just be allocated funds to whatever organization can do it.
So I have a comment.
Yes.
I didn't raise my hand, so I'm raising my hand.
Absolutely.
Okay, so but I agree with Kristen. That's sounds like good advice. Also, one of the things I mentioned before, what we fail to do as a committee is close the loop and follow up and make sure that what we decide actually moves forward. So I'm hopeful whoever makes the motion that it will have a component to it of it comes back up in another meeting maybe in a month or two to see exactly what happened, because we need to close the loop. It's plan, do, check, act, right? You need to make a plan, you check on the results, you change the plan, and then you make a new plan or whatever. I mean, you need to move it forward and check on the results and make sure that you're getting what you paid for. So I'm hopeful that this can have that kind of component in that motion. Thank you.
Thank you, Mr. Liberty. Do I have further committee comment?
Yeah, this is Commissioner Angelo.
Commissioner
Lloyd,
Angelo.
I think Lloyd was first. I'll go after Lloyd.
Okay, real quick, just to confirm with Janine, you're proposing $350,000 for 4 years, and then after that, because you're asking the provider to apply for grants and seek additional funding, you're not committing to more than 4 years. Is that what I'm reading?
Yes, that's correct, Lloyd. We would only be committing for 4 years with the proposal that they would be looking for grants, additional funding, and I would expect outcome measurements to be provided and reported back to this committee.
Thank you.
Mm-hmm.
Commissioner Angelo.
Thank you. So I think that, we have a lot of contractors, and I'm sure the city probably does as well, that participate in county government, because we obviously want the community to participate, and that at time, there could be a perceived conflict, even if there isn't a conflict. In this case, I guess my clarification, Lloyd actually asked the question and clarified for me, so thank you. But what I'm hearing actually from Dr. Miller and from Commissioner Ferretta is that NAMI is actually the optimal organization that would be doing the outreach education to the community, to the families, and certainly around stigma and other areas. So, it's unfortunate that if this is going to move forward, and I'm not certain, I don't have a crystal ball here, but is it something that you would just bring forward to actually allocate the dollars on a contract with very specific deliverables to NAMI? Is that something you would normally do? And we're not doing it because we do want this to be a competitive process when we know we may have the best organization? And if so, is that, I guess I'm just asking the question, just knowing government for 26 years, it would seem that if this was a different funding stream, we might be able to marry it right up to the organization. And we're not doing that here. So I guess I'm not sure if you could just wave a magic wand and do an optimal process here with outreach and education to the community, to families. How would you do it? Is this the way you would do it? I'm asking Dr. Miller.
So yes, the Behavioral Health Advisory Board and the Behavioral Health Department, when this was one of our top topics, and I would just say it's been something we have wanted and needed in this community for a while. So this is not a new desire or need. We know that we need this in our community. And yes, our NAMI is underfunded here. Our NAMI is nothing compared to California NAMI or national NAMI because we don't have the funding for NAMI. And that's not a negative. Our NAMI is great. They're all volunteers. But what we see and what we know can come out of a NAMI is absolutely amazing. So if I had the ability right now to fund NAMI, regardless if it was Measure B dollars, which I would choose NAMI as my the entity that I would contract with, and I would have a contract going with them today if they were willing to contract with me, because I know that's the best place to do it and the best organization in our community.
Thank you. And just one final comment is that my understanding from my colleagues in other counties is that NAMI is much more developed in some of the larger counties that has millions of dollars to dedicate to mental health and to give to an organization like NAMI. And so I have often wondered why our NAMI organization is as small as it is. And so you've answered that question. And I hope that this is something that we could move forward with. So thank you, Dr. Miller.
I want to just say that I agree totally with Dr. Miller that this would be the organization that if I had a client and they needed some psychoeducation and stigma reduction, all that, I would refer them to NAMI. I mean, that is the standard go-to practice for mental health issues.
Thank you, commissioners. I am going to recuse myself from this just because I am. But if there is a motion on the floor, I will accept it. I will be abstaining from the vote.
so Chair Muschetti, are we ready for a motion on this?
Unless oh, sorry, I'm wrong. I need to ask for community comment. Thank you very much. Is there any community comment?
Yes, we have Bernie Norvell.
Where is he? Bernie.
Yeah, I actually have had my hand up for quite some time. I wanted to speak on the housing, the 1.3 million that you were voting on earlier. So I will submit a letter in regards to that, and thank you for recognizing me.
Thank you, Bernie, and I'm sorry I missed you. Lily, do we have any other further community comment?
No.
Do I have a motion on the floor regarding recommendation for housing? I mean, excuse me, for community education. Commissioner Diamond.
Yeah, I would like to, if I understand the recommendation from Commissioner Miller, it's to recommend the community education as specified and to be able to recommend that NAMI be the organization that we are awarding it to. Am I right on that, or is that your recommendation?
Dr. Miller?
That would be my recommendation, Jed, but I realize if we can't pass it with it going to NAMI, I would then say that we would look to do an RFQ. I do not want to do an RFP because it's a longer process. And we want these monies in our community. I don't want to spend 3 to 6 months going through an RFP process to award these monies. We waited too long already. So my preference is yes, my recommendation would be that we work with NAMI on this. If we can't do that, and we do want to do an RFQ process, I would prefer that. We really want this process. We really want the monies in the community today and not wait 6 months.
Well, that makes sense to
I
me.
second the motion.
Yeah, I would make the motion that we follow the guidance of the committee and make the motion that we recommend it as discussed, and that we make the recommendation that we send it to the Board of Supervisors for consideration.
Chair Muschetti, I would second the motion.
Okay.
And I would also like to comment that if this actually went through an RFP process, that would take time and that would take Measure B dollars. And so I appreciate Dr. Miller being forthright and also recognizing those organizations that are available in our county, and Commissioner Diamond for making the motion, and I second the motion. Thank you.
Do I have further committee comment? And I know Ross, you wanted to comment. Ross?
Yeah, actually, I was sort of waiting for Christian to weigh in on this. It just seems like we're pointing it to a specific organization without, that just seems odd to me that you could do that with public money.
Christian?
If I may, Madam Chair, thank you. There's some potential conflict issues here. Frankly, I don't have the answer at my fingertips. I am going to have to look at this. I've pulled up Government Code Section 1090, etc. There's a handful of exceptions that may apply. I'm going to need more information to know sort of exactly what the county is and is not going to be able to do before the board votes on it. You might want to keep the recommendation sort of flexible enough such that it doesn't have to come back here if I find that one specific route is viable, or sorry, not viable.
Well, I would amend my motion to take what Christian said into account, that if there's a problem, that it be worked out appropriately and get passed on in whatever way we can legally do it.
Just for ducks, my personal comment is I would like the motion to not name an organization. That's just my opinion.
I'd be guided to whatever Janine has recommended, if you want to amend it that way. I just tell you where I'm coming from. I think what I said earlier. I think we need to trust the professional input that has been developed in these very difficult times to make recommendations, that we make decisions as quickly as we can, that we know we want, and that we not have undue hesitations or undue detours to getting services to people that need it. And whatever we can do to keep things moving along is the feel of my recommendation and why I'm making the motion this way. So I'm guided by whatever you all, Janine, feel is the best way to move this along as expeditiously as possible.
So maybe, Jed, a suggestion so that we keep it flexible with what Christian noted. Maybe we make the motion specific to that the behavioral health director will choose the agency that we award this to. And whether that, when I work with Christian, I have to do the RFQ, I do that. If not, then I will do that. And if I will work with Christian to make sure we stay within government code and everything.
That makes sense to me.
So Chair Muschetti, may I make a comment as the person who seconded this motion?
Yes.
Okay, so, whatever legally we need to do is what we need to do. And I fully support Chief Counsel Curtis in his comments and what his legal opinion is. I would say that throughout the last 3 years, one of the many, many issues with the Measure B committee is conflict of interest or perceived conflict of interest. It wasn't that long ago that this committee, the Board of Supervisors, we were all asking Adventist Health for a proposal for inpatient beds. So tell me why that's not a conflict, and going with the National Association for Mental Illness at the local level is a conflict of interest. You either, if we don't vote this in, that's fine. We don't vote it in. That would not be unusual for this committee not to vote something in. But, it's really unfortunate, and it will cost the Measure B committee money and time to do this. So I still want to be the second here. I still second this motion. And I agree with Commissioner Diamond that at some point we have to realize that we have mental health professionals in our midst and that they may know better than some of us. So I second the motion. Thank you.
Any further comments? Any community comment? Lily, do I have any?
No, none.
Commissioner Allman, do you have something? You unmuted yourself.
Nope.
Okay. So Allison, would you read the motion back, please? And Commissioner Diamond, if it is not correct, please say so.
The motion has gone through a lot of iterations. So what I have is to recommend to the Board of Supervisors that the Behavioral Health Director recommend to the committee that we have a local agency, I guess, tailored to community education as specified through Measure B. And that is for $350,000 for 4 years. And that is all.
Do you agree with that, Commissioner Diamond?
If it's worded the way Janine said it, I'm not sure that quite captured it. Maybe Janine could re-say it, because that
Sure. Sure. I would word that to say something more like that the Measure B is going to recommend to the Board of Supervisors contracting with an agency for community education awareness and support in the amount of $350,000, and authorizes the Behavioral Health Director to award and sign off on that contract.
Commissioner Diamond?
Just a clarification, was that $350,000 per year or?
Per year for 4 years.
Got it. That's what I wanted to get clear.
Got it. Are you okay with seconding that, Commissioner Angelo?
Yes.
Please call for a vote.
All right.
It's getting late in the day. We're working hard. Hang in there.
For sure.
What's happening? All right. Member Ullman,
Aye.
Member Barish.
You're muted, Ace.
I think he may be gone for.
No,
No,
he's
I'm here.
there.
There he's there. All right.
Sorry. Yeah, I vote no.
Okay. And let's see. Member Myrtle,
No.
Member Weir,
No.
Member Miller,
Yes.
and Chair Muschetti is abstaining. Member Diamond,
Yes.
Member Riley,
I'm abstaining. I got disconnected there and I missed part of the discussion, including the motion, so abstain. I apologize.
Sure. Okay. Member Liberty,
Aye.
Member Angelo,
Yes.
and Member Beretta.
Yes.
Okay, so that's 1, 2, 3.
Okay, thank you, everybody. Moving on to
Wait, let's hear what the tally was, please.
I had it as, and tell me if I'm wrong,
Okay.
ayes, 3 nays, and 2 abstained.
Yep.
How many ayes?
6.
Thank you.
That's the majority. Crisis assessment and psychiatric hospitalization aftercare. We're getting there.
All right. So this is, I'll just do a brief. This is once again, as individuals are discharged from the psychiatric hospital or that they've had a crisis assessment. So if they've come into contact with crisis, they're going to get aftercare, which they currently don't get. If they have insurance that's not Medi-Cal, and if they are discharged from a psychiatric hospital, they also do not get aftercare at the same as someone who has Medi-Cal. So this is making sure that every client that comes into crisis, whether they're hospitalized or not, will be offered 60 days aftercare follow-up so that they can be connected through their insurance to providers, make sure their medications are refilled, they're able to get back into the community with some supports in place as they connect to services.
Committee comment, please.
Well, I do. And we're right on the track of getting improved services. That's what Measure B is all about. But how would these be delivered? Would it be delivered by the government? Would it be delivered by a nonprofit, an NGO? What's a mechanism for this?
My thought process is that this would go in line with what we already do for crisis. So the current crisis provider, because they are the contacted provider who would know who the clients are, which is the entity that currently provides the aftercare for Medi-Cal and indigent clients, that they would get some additional funding to make sure that they are connecting with every single client and not just those clients that get that have Medi-Cal or indigent services. So this would be in addition to the services they're doing and allow them to provide that same service they're doing for Medi-Cal and indigent clients to all clients they touch.
So is this money for personnel or is it for tangible items like prescriptions and things like that? Putting gas in your car or what? I don't understand.
It would be for personnel. It would be to pay for the services. It would be service specific. So it would be a service touch. They would bill just like they bill Medi-Cal. Instead of billing Medi-Cal or billing they would bill like they would do Medi-Cal. They would bill for the service touch. So they would bill just like a Medi-Cal billing. So we would look at it like a Medi-Cal billing and they would get paid for that service, but it would actually have to be, it's not staffing. It's based on number of clients they serve and the service they provide.
At the Medi-Cal rate?
Yes, at the Medi-Cal rate.
Committee comment? Commissioner Diamond.
Do we know, Janine, about how many people we're talking about?
I'd have to pull the number up, but off the top of my head, last year, I think we hospitalized 684 individuals, and I think 447 of those had Medi-Cal. So the other remaining individuals did not have Medi-Cal, so they didn't get the follow-up care.
So 237?
Yeah, so about 237 individuals would, depending, I mean, the numbers change each year, so it could be a little bit less, could be more, but it would be, if you look at last year's numbers, 18, 19 numbers, that would be an estimate of what we would touch.
So would the sense of what you're recommending be the reason that they're not Medi-Cal is they potentially have private insurance or the people can pay? Is that true?
Yes, technically they have private, most of them have private insurance. Some of them have Medicare, and Medicare will not reimburse for this service. Some of them have the VA. So it's a variety of different things. It's actually that their insurance does not pay for this type of services. And there's supposed to be a connection when they discharge from the hospital for a follow-up appointment. Well, I will tell you, while that's required by law, those follow-up appointments, sometimes they tick off that they scheduled a follow-up appointment and you just don't know who they scheduled it with, and the clients don't actually get connected to services.
Okay. So just so I'm clear with what you're recommending is you're recommending that Measure B pay for the services directly for these clients that would not fall under Medicare or Medi-Cal, I mean?
Correct. Those clients that wouldn't normally get this service.
Okay. Would there be a potential for billing to go through some other insurance entity if there was a connection made, or is it automatic that it would not be able to be paid for except through Measure B money?
So we require currently that they attempt to bill for every touch they do on a private insurance or a Medicare or a VA client. It's if they were to get reimbursed, obviously they would not bill Measure B, but I will tell you 90% of those private insurance never reimburses. So we would ask that they attempt to bill. We would ask for this statement, the statement that they got denied for services, so that we know that they attempted to get reimbursed. We would do it just like we currently do in our system of care. You have to bill based on the touch, how long was the touch, and then obviously, did you attempt to bill the insurance carrier and did you get denied?
Okay, thank you.
Mm-hmm.
Mika?
Janine, does this solve the issue that we've talked about before? If you are within one of the rural health centers and you end up having a 5150, that the client is then doesn't necessarily go back to their primary care doctor?
It solves the.
We've talked about that. Can you
Right.
explain that?
Sure. So it solves a little bit of that. It would solve that issue in that they would have 60 days of hand holding to do a transition. So one of the things that we see in the specialty mental health field is that a lot of times once a client's been placed on a 5150 and hospitalized, the doctor that they're currently seeing, even if it is a psychiatrist, no longer wants to serve that individual because they automatically in their mind are classified as an SMI, which is a serious mentally ill client. Unfortunately, that's not how Medi-Cal classifies people. It's based on functional impairment, not whether you're put on a 5150 hold. So there is, as Mika talked about, is something in the Behavioral Health Advisory Board that we deal with on a regular basis, is that clients sometimes don't have a home to go back to because now that they've been hospitalized, their treating physician no longer wants to treat them. And so, yes, this would also solve that gap, a little bit of having a 60-day follow-up to make sure they do get connected. It also solves the gap that we talk about of people who come back, they'll get their meds, and then we hear that they're back on the street corners or needing to be re-hospitalized because there was no insurance follow-up.
Okay.
Thank you.
And is there an amount attached to this? I didn't hear it, or it didn't.
So yeah, we are estimating about $260,000 for same thing for $260,000 a year across 4 years. We really are going to push that we collect some really good data and push back on the insurance companies. It's one of the things we are pushing across the state of California, and there's a lot of movement that we need to have parity across our systems of insurance payers, and parity does not exist today, even though it's legally supposed to. And we have found that sometimes when you have the evidence that you can prove it's worthwhile, you can get more movement with the insurance companies to pay for a service.
So is the recommendation that it would be up to 260,000, that if you could get reimbursed, it wouldn't be that would be the cap on Measure B funding that you're recommending?
Correct. It would be a cap of 260,000. They would have to submit invoices just like they have to submit currently for Medi-Cal.
Gotcha. Thank you.
I have a question.
Yes, Ross.
Actually, when I see, I love the plan. I like the idea, but I look at 260,000 and think, that's like, that's like maybe 2 people, and I just don't.
That's where we came up with the dollar amount. It's based on how much it would be to bill and provide an aftercare service per individual, and that's based on a per minute rate. We could also do a negotiated rate, but I do think 260 is a good amount.
Further committee comment? Lily?
Yeah, this is Lloyd.
I'm sorry, Lloyd, go ahead.
Again, you have it in here for 4 years. What happens at the end of that term?
Once again, we are hoping that they will either come up with some alternative fundings or we have worked to really show the insurance companies that they need to pay for this service. I'm also hopeful that there's a lot of movement at the state level to bring insurances to parity level, and there's a lot of push from our government to make changes there. So I'm hopeful, hopefully before 4 years, there's some movement in that area, and we may not need the full 4 years.
Thanks.
Further committee comment? Lily, do I have any community comment?
Yes, Jan McGordy.
Miss McGordy, are you on?
Am I on?
You are on.
I'm on. Okay. Well, first of all, I just wanted to say that I find it outrageous that the insurance companies don't show the lack of parity that they're legally required to do. And in the past, the Behavioral Health Advisory Board actually recommended the Board of Supervisors to push their state legislators to encourage insurance companies to provide the parity. But back to the issue on hand, the aftercare of people coming out of a psychiatric facility is really, really important, because if they don't have that case management and hand-to-hand looking after, they go right back into the cycle of 5115 into the ER or ending up in jail, and it just goes round and round and round. So I can't emphasize enough how important it is that there is aftercare for people, because when they come out of a psych facility, they've been heavily medicated to be stabilized enough to be released. They really aren't fully functional, and they need aftercare, which isn't provided if you're not on Medi-Cal, which is ridiculous if you ask me. So I hope that you guys can understand the imperative of this service. Thank you.
Thank you, Ms. McGordy. Anyone else, any other further, Lily?
No.
Any other committee comment? I need a motion on the floor, please.
Alman will make a motion to approve, to recommend to the Board of Supervisors that they approve it as it was presented to us.
I second.
Allison, can you call for a vote, please?
Who was the second, please?
Commissioner Diamond.
Thank you. Okay. All right, Member Alman.
Aye.
Member Barish.
Yes.
Member Myrtle.
Yes.
Member Weir.
Yes.
Dr. Miller.
Yes.
Chair Muscati.
Yes.
Member Liberty,
Aye.
Member Angelo,
Yes.
Member Ferretta,
Yes.
Member Riley,
Yes.
and Vice Chair Diamond.
Yes.
Thank you.
We good, Allison?
We are good.
Okay, next, mobile crisis team.
All right, so this is something that we have had a lot of interest, I think, throughout the last 13 years, a desire to have some form of a pilot of a mobile crisis team. It is something that we're bringing forward today. It is one of the part of the crisis intervention training models that are out there, crisis intervention teams. There is a really push for mobile crisis teams, the benefit to not have law enforcement, the only person on the scene when you have a mental health crisis, to really have the ability to have a trained professional to de-escalate the situation. While we've had some great CIT trainings, we think that the next step to that is looking at this pilot model to see how it works. There are a lot of different models out there. We've done a little bit of research to look at the different models. There are models where mental health does not go out with law enforcement, and I've seen positives and I've seen not so positives. In some of the counties we spoke to, mental health workers had been actually killed or disabled for not having law enforcement on scene when needed. This model here proposes a pilot with the Sheriff's Office to have a pilot program where there are some mental health rehab specialists that would be in with the Sheriff's deputy to respond to mental health calls. That could be wellness calls, that could be any type of substance use calls. It could be something where they have a domestic dispute where having someone that could de-escalate could help that situation. It is a pilot program. We are once again asking for the dollars for 4 years to roll this out. In the meantime, I will be looking to see if there are some other funding out there. I always look for grants. There are always some additional things. It's not something we can easily, readily bill Medi-Cal for. If we are able to for a section of it, then of course I would bill Medi-Cal and we would not bill Measure B for those dollars. But at this point, it really isn't something we'll probably be able to bill Medi-Cal right away for. And so the projection, so we are asking that for this ability to do this pilot project with the Sheriff's Office for 4 years with the funding at $340,000. That does cover the staffing cost for that program. And that's what that dollar amount is. And I believe that Sheriff Kendall did want to talk about this a little bit, Donna.
Okay, can you hear me?
Lily, did Sheriff Kendall log back on?
I'm on.
I can hear you.
Did Sheriff Kendall log back on?
Yeah, I'm on. Donna, can you hear me?
I can hear you. This is Mika.
I can hear you.
Okay.
Yeah, I can.
So what I started doing was I was looking at Butte County's model after I spoke with Dr. Miller. Dr. Miller had a lot of experience previously in dual response model. Currently in Mendocino County, I did a real quick and dirty
Can everybody hear me?
services. Can you hear me?
Yes.
Okay. So
real
I do not see Sheriff Kendall on here. Does anyone from the committee, while we're waiting for him to log on, have any comment?
I can hear Sheriff Kendall.
Donna, he's on. We're listening.
Oh, he's on. I'm sorry. He's not on mine. I apologize.
All right, let me just run through it real quick. Dr. Miller and I had discussed this dual response model, and then I spoke with Sheriff Honey from Butte County, who currently has one in place. I did a real quick and dirty, just real quick survey of about a week's worth of calls, and it appeared that almost 40% of them dealt with mental health or substance abuse in one form or another, between domestics and things like that, and basic calls for service on the street. So currently, Butte County's model employs one deputy sheriff in a vehicle with one mental health worker, behavioral health worker. And the numbers that he provided to myself and Dr. Miller were absolutely incredible. They saw a 33.2% decrease in 5150s, 47.4 decrease in the number of transports. And we have to remember that he only had one shift that was doing that per day. So that's roughly 33% of the day to get those numbers. He's currently moving it into a second shift, a swing shift. Butte County has seen several other benefits which were unintended, but these included working model by placing personnel in the same vehicle. Both behavioral health training went to their deputies, and officer safety training, was provided to the behavioral health workers. It's become very clear that the dual response model has ended a lot of siloing, especially in that county. Having the two disciplines in the same vehicle has caused better service for the communities. Years ago, we had a deputy sheriff who worked for us who actually had he works for David Eister now, but he had a degree in psychology. And numerous calls that we went to, he recognized right off the bat what we were looking at due to his training and experience, and having a degree in psychology. It probably saved us a lot of headache, heartache, and strife that he recognized the issues that people were going through. However, it's very rare that you get someone to be a deputy sheriff with that type of a background. So, just being able to work with him over a few years before the district attorney's office grabbed him as an investigator was a really good thing, especially in the north where he worked, because he was providing training to the deputies based on his skill set, and a lot of it is still serving us now. And so I think that if we look at this and just look at the raw numbers that Butte County has, I'm certain that we can get somewhere in Mendocino County also. I'm not sure what happened with Donna, but.
Shannon, do you want to talk?
Thank you. There's Donna. I don't know. Her lips are moving, but I can't hear her.
I don't think her internet is wrong.
I've been kicked in and kicked out about 4 times. So
okay, we can hear you now.
Pay no attention to the man behind the screen.
Okay. I support. Oh, sorry. Should I go?
Sheriff, are you done?
I am finished. Thank you.
How about if I just go ahead? Can everyone else? Okay, good. Thank you. I support mobile outreach teams or mobile crisis teams 150%. I agree with everything Sheriff Kendall just said. My concern about this item is that it is only a pilot for the Sheriff's Department. So that means it would be serving the unincorporated county when the majority of the tax revenue for Measure B comes from the incorporated cities inside the city limits, and the majority of the population is inside the city limits. So I have real concerns about allocating money for something that is only serving the unincorporated area. Not that there isn't a need there, but I think this is a tremendous need for the entire county, including inside the cities. And would be willing to allocate more money if we could serve the entire population, particularly right now with the concerns about how police are handling specific types of crises. This is more important now than ever. Our public safety departments are asking for this. So that's my concern, is I think it needs to incorporate the entire county.
As MOPS did. MOPS incorporated the cities. And so I understand your argument, but I believe that the program, and I certainly would support it if it was countywide. So I think we're on the same page here. It's going to be in the populated areas, and there's no city boundaries for mental health. We know that. So I think that motion is going to be okay. You're going to like it.
Okay. Well, my concern was because it's a partnership with the Sheriff's Department in particular. You're telling me that the Sheriff's Department is going to respond within the cities?
Listen, I'll speak as a former sheriff, and if the Ukiah Police Department stepped up and said they want to have a person on this, I'll bet you we could figure out a way to do it. It's just mental health is something that law enforcement agencies try to step away from. So the sheriff's, I'm going to assume Sheriff Kendall, and he's still listening, is doing this because he's taking the lead on it and would welcome the other 3 police departments to get involved. But the line of people wanting to get involved is very short.
Shannon, I think you made the sale.
And Shannon, if I can jump in here real quick, I've spoken with Chief Wyatt regarding this, and I know that Chief Wyatt would be more than happy to jump in also.
Yeah, I can't speak on his behalf, but based on other conversations that we've had, I believe that to be true as well. I've heard similar sentiments from Chief Nolte in Fort Bragg. So yeah, my support for this item would be contingent upon it being provided countywide.
I'd just like to make a comment. I don't know if I was part of a very similar team early on when I worked in San Joaquin County, and I agree with everything that Sheriff has said and that Shannon has said. This is a very, very good way to handle this. And I can speak as a mental health professional that the cross education between law enforcement and mental health professional is helpful, and being able to provide the service is helpful. I think it just needs to get implemented as soon as possible. That's, again, I think that's been my theme. And whether that's, certainly it's needed everywhere, and whether how it can get, if it's a pilot program, I'd like to see it tried out wherever would be the best place to try it, because I know it's going to work if it's done well, and then it's going to be something that will be incorporated, I'm sure, everywhere in the county once it's proven to be successful. So I would bow to whoever, can speak to the nature of it being a pilot program, if that's necessary. My just question is, where best to pilot it? Should it be piloted all over the county, or should it be piloted, in conjunction with the sheriff, because he's stepping up and saying he knows he will do it?
So, Jed, Donna said she's probably going to need you to take over because she keeps coming in and out. So just know that you'll probably need to chair the meeting until she can get back on. But let me respond. I'll respond to that. This proposal is a pilot. We want to see the benefits. We did start with the sheriffs because they are in the outlying area doing the rural outreach, why we have crisis centers in the local area. So to roll that out into the local cities will be easier than to roll it out into our big communities. So like I said, I spent during my doctorate years in the city and county of San Francisco doing mobile crisis. It's 10 times easier to do in a city than it is to do when you're on a rural route and you're going all over. It takes longer to get there. It's going to be harder to pilot it with the sheriffs than it will to roll it into one of our cities. Many cities do this already. If we want to roll this out as a more universal model, we need to have that conversation that the current dollars being asked for will need to be more. And so I want to put that out there. My hope is that we pilot this and we start with the one area that's going to be the hardest. If we can be successful there, we can be successful anywhere. And I think Sheriff Kendall is really willing to work with the city police to roll it out more in the future and here's what we learned. There's going to be things we learn in this process. It's kind of that thing when we had the PDSA, the Plan, Do, Study, Act. You don't roll something big out across the whole entity and have it fail. You roll it out slowly, you plan it, you do it, you study it, and then you roll it out as a big project. I don't want to roll out mobile crisis in a huge project, have it fail when it could have been amazingly successful if we had rolled it out slowly and did it right the first time. So we can look, and we can keep bringing this back. We can look at it in 6 months and say, is it doing great? Do we look at expanding it across our community, and what's that dollar amount going to be to expand it? This is a proposal. We do want to see mobile crisis. We know statistically, I think we can look anywhere and see the successes of mobile crisis programs. They're all done different ways. We may roll this out and say, this isn't the best model. Mobile crisis is a model, but we want to look at a different model than the way we currently set it up. And that's where that Plan, Do, Study, Act is so important. Roll it out. Let's look at it. Let's evaluate it. Let's decide what's the best. A lot of these programs are not in big rural communities like ours. We have a large amount of area to traverse to really roll this out well. A lot of times you see it in the small cities. You see it in the city of Berkeley. You see it in the city county of San Francisco. That's a small area. You see it in Sonoma County, but it's only specific areas in Sonoma County. They don't serve their whole community. They're not out throughout all of the county of Sonoma County. So that's why we are saying, let's start as a pilot. Let's do it where we know it's going to be a little bit harder to do, but if we can accomplish it there, we already have some workers in those rural areas. We can change what they're doing. I have the sheriff on board to work with us to really change the dynamic. This really changes the relationship between law enforcement and mental health, and you have to have your officers on board to change that relationship. If the relationship doesn't change, the program will fail. They have to become a team. Everywhere I've seen it done, you have to be a working team. You have to respect each other, and you have to be able to take advice from each other, and be able to have that respect.
Okay, well, I think you've made your case, I think, fairly effectively between the two of you. Is there any other discussion from the committee? I think Mika had your hand, and then Shannon.
Thank you. I would just say this is also another use that we of the regional training center, as far as getting those relationships worked out.
Yeah. Thank you, Shannon. Go ahead.
Yeah, thank you. I totally agree with and understand Dr. Miller's approach, and I totally support testing something before you roll it out permanently. But the way this item is written, it says this is a 4-year pilot. So you indicated, Dr. Miller, that we could check in on a more regular basis. Absolutely will not wait 4 years for this to be rolled out inside the cities. I'm also hearing from Sheriff Kendall that he has had conversations with the local police chiefs and is willing to work with them. So in spite of the fact that, you say we already have crisis centers in the cities, that's not the same service. They don't go out and respond to people. They're not working directly with public safety. So again, the vast majority of the funding for Measure B comes from within the cities. The vast majority of the population and the service providers are in the cities. And I think if we're going to bite off a chunk of people to test on, I think let's pick the low-hanging fruit, not necessarily the handful of the most remote people. So again, I really want to see this happen. I want to see it happen in a bigger way, and I want to see it happen as soon as possible. So I'll only support this, again, if there's collaboration between the jurisdictions and if we're not waiting for 4 years to potentially expand the project.
Okay, thank you, Shannon. Any other committee members want to weigh in on this?
I do, because this is a living, breathing way, and we have to get started. We don't know what we don't know. And I know Sheriff Kendall well enough to say he's not going to ignore the other 3 police chiefs. But I mean, if you want to make that stance that you're not going to support this unless we do it, then I'm going to make the stance and I'm going to support it and not include the cities. And then we're going to build up a wall. We are going into this as friends to do what we can to improve the services to the mental health population in our county. And nobody, and I know 100 law enforcement officers in this county, nobody is saying we're not going to respond to that area because he's in a city or he's in a county. We're going to do what we're going to do. So please don't say that you're not going to do it because we're doing this, because you're building a wall, Shannon. And unless you know that we are going to exclude the city of Ukiah, I think that we need to go in this with our eyes wide open and say, and as we adjust our sales, as it goes down, if there's problems, then we need to adjust them. But this is no room for building walls. Thank you.
No, my intention is not to build a wall at all, but the way this is written says that we'll look at it after 4 years. I don't want to wait for 4 years to revise or expand this program into the cities. That's my point.
Then we need to have a monthly review of it at our other Measure B meetings. It's very simple. And then if there's a problem, we adjust our sales.
Raising my hand here.
Yeah, let me just kind of summarize what I'm hearing so far, and then we can get any other input. It sounds like we're in general agreement. I think we want it soon. We want it to be able to get into practice. And the only question is in the wording of it, as I understand it with Janine, if we're looking at a 4-year process, we know we want to test it out and we want to then get it implemented more broadly wherever we roll it out. So I think we're close. I think it's just a matter of how that gets worded when a motion is made. So I know we're late in the day, but we want to keep moving on this. I think we're getting a lot done. So any other input from any members of the committee that want to speak to this?
I have some input.
Sure, go ahead, Ross.
Actually, I would ask Shannon, make the motion, and then we can make sure there's no walls built.
Well, we'll do that. We still need to get community input, but yes, I think your point's well taken, Ross. Any other input from the committee? I can't see everybody, so if you're on a call, just go ahead and speak. If you're on the committee.
Jed, I'd like to add something really quick, Jed. Just
Sure.
I want to note that we're asking, I want to be clear, the 4 years is because we don't want to start something and then not have the funding to complete it. That does not indicate that we would not spread it out and if it's successful, make it move into other parts of the community. The 4 years is as a pilot. We want to make sure we have the funding to start a project and keep it going and not start it and ask for a year and project we think will change and then we don't have the dollars. So I don't want to start something and have it fall apart or not be able to fund it going forward. So we really want to give this pilot project the time and the dollars to do it. I'm happy if this is, within 6 months to a year, if we know this is successful, to come back and have Measure B potentially look at giving more money so we can roll it out across our cities and stuff. Also, just in the note, I want to make sure you guys note that in the write-up, I am asking, we also recommend that outcome statistics are tracked and reported. That means reported to Measure B so that information can be provided on the success of this program. I am expecting that we will be tracking and providing regular updates on the success of this program so that we can make decisions to go forward.
Good. Okay, I'm assuming everything is going to be tracked that we've talked about today. So any other input from the committee before we open to any public comment?
Mr. Vice Chair, there's just one issue I'd like to make sure the committee is aware of.
Go ahead, Christian.
Thank you. So, and this is sort of related to the prior item as well. So I want to explain my concern with the prior item and something that may be relevant, and I'm not sure at this point if it's relevant to this item, is that there are issues that come up when we have any member of the committee potentially voting or acting on something that may involve the county contracting with Measure B funds with any sort of outside entity. So with respect to NAMI, having a member of the Measure B committee on the board creates potential, or on the committee also being part of NAMI creates a potential for conflicts there. The same would be true if this proposal involved any potential conflicts with the city. Now, there are some exceptions. The rules are written primarily with sort of for-profit corporations in mind, and there are a number of exceptions that I'll need to take a look at. And based on the discussion, I don't know that I understood whether or not the mention of the cities would possibly involve sort of funding the cities or contracting with the cities versus just offering a service within city territory. But if there is a potential for that, frankly, it reduces the likelihood that we'll find a conflict if there's a recusal before prior to the vote for anything related to that, in the same way that Chair Muschetti did for the prior item. And again, I'm not entirely sure that I understood that this would necessarily involve that, and there may be exceptions that I need to research some more. But I just want to try and flag that issue so that the committee and I guess Member Riley in particular are able to make an informed decision prior to the motion and the vote.
Thank you, Christian. Let's open it up to any community input. Lily, can you tell me if anybody's got their hand up?
Yes, Jan McGordy.
Jan, thank you.
Hi, I just wanted to share with you guys, I've been an advocate of CIT for several years since I first learned about it at a NAMI National Convention, and that CIT is more than training. It means crisis intervention teams. the Behavioral Health Advisory Board actually recommended to our Board of Supervisors that CIT, crisis intervention teams, be adopted within the county. Of course, nothing happened there. But I want to thank Sheriff Kendall and also former Sheriff Allman for supporting this. This is really exciting to get this positive thing going. There was actually another presentation at the last NAMI convention last month that you can probably access online. And the crisis teams, have found best when it's a partnership versus a mental health worker embedded within the law enforcement system. And it's also best when the deputies or the law enforcement representatives are specially trained individuals, because not everybody has the capacity to do this job. It's special training. So I'm hoping that that your committee will pass this, because it's really exciting, and it's a step into the future that I can see. Also, I wanted to make you aware that the CIT International is having a virtual conference next month, and it's always very exciting to hear their presentations and all of the things they have to say. So if you want to know more about it, that's the place to go.
Good, thank you, Jan. Moving along, we want to hopefully get as much done and finish our meeting. Any other community input?
No.
Okay, I think Shannon wanted to say something from the committee.
I'm ready to make a motion if the committee has no further input. I move that we recommend support of the development of a mobile crisis team in partnership with local law enforcement to be reviewed in 6 months.
Allman will second that.
Okay, we have a motion and a second. Any discussion?
And this is Commissioner Angela. Could you reread that motion, please? Someone?
Shannon, you want to say it again?
I can restate it. Yeah, I support the development of a mobile, or support recommendation, I guess, to the Board of Supervisors, the development of a mobile crisis team in partnership with local law enforcement to be reviewed in 6 months.
Okay. Tom, did that fit with what you seconded?
Yes.
Okay. So do we call for a vote at this point?
Sure.
Yes? Okay. Allison, can you take the roll?
I shall. Member Allman,
Aye.
Dr. Barish,
Yes.
Member Myrtle,
Yes.
Member Weir,
Yes.
Dr. Miller,
Yes.
Chair Musketti. Oh, wait, she's not here.
Allison, she texted and said, yes, she can't speak for some reason, but she wanted to make sure her vote got in.
That's a
Okay.
yes. Okay.
So recorded.
Vice Chair Diamond,
Yes.
Member Riley,
Yes.
Member Liberty,
Yes.
Member Angela,
Yes.
and Member Ferretta.
Yes.
Okay, thank you.
Okay, well, I guess dawn, it still isn't on. I see we're getting towards the end of the hour and way past our 3 o'clock break. I know there's still items, I believe, that are still on the agenda. I'm feeling personally, I've got some other things I still need to do. And I would personally like to see whatever is on the agenda put off till next time, unless there's something that's really critical that we need to hang in there for a longer period today. Any thoughts on that, committee?
There are several very timely things that we need to get through as far as staying on track with our projects. We got to push through.
Okay.
Yeah, so Jed, if we don't, one of the items is the crisis residential treatment, and if we don't put it through this meeting, we may probably lose the $500,000 grant funds.
Okay. Well, why don't you, whoever is, I don't have the item in front of me, whoever needs to present that one, why don't we start with that one? I don't know if that's in the next order, but could we address that one first?
Well, the order of the rest of this, we have to discuss the crisis residential treatment facility and the PUF, and whether or not those are things that the committee is interested in, which then goes into pricing the actual showing an explanation of what the process and project has been so far, and then that concludes the meeting. So I don't really know that we can cut topics out of the agenda.
Okay, so
In terms of the time, how much time do we need to finish everything?
Am I back in? Can you guys hear me?
Yeah.
I can hear you.
Okay, so I apologize. Wasn't my fault. I'm going to say that. So did we get a vote on the mobile crisis team?
We did.
Okay. Did we get a vote on the crisis residential treatment facility?
No.
That's where we are now. I was saying that
we need to do it. I know we are over time, but these are very important things and these need to be done. Is Knock and Lewis still on the line to present?
Yes.
Yes.
Okay,
So sometimes we have to sit here as volunteers and do things. So we voted on the mobile crisis team. We are on crisis residential treatment facility. Is that correct?
We are.
Yes, Donna, the last two items on the collaboration, I think can roll in. I think we don't have to address those two because they're already part of the rest of the conversation and the other items. So to save time, I would just say that the committee recommends that we do build a CRT and a PUF, and that I would also add that we have put out an RFP for a crisis residential treatment facility operator that is in the processing through the county's processing, and we hope to see it posted within the next month. And also, people asked if the RFQ for the PUF would be written, and I wanted to just give an update on that since it's on our list. That has been written. I wrote it, I submitted it, and that too is in the county process, and hopefully we will see that posted within the next month. And I think we can move on from there, Donna.
Okay, so I'm sorry, I apologize again that I missed everything. So we're good to move on?
Yes.
Do I hear any antis from the rest of the group?
Depends on what.
Sorry, I'm on my phone, so it's going to be really, really hard for me to do this, but we will move on to item 3D, discussion and possible action regarding estimated proceeds, et cetera, et cetera. This is on Auditor Weir and Dr. Miller and Allison. Member Weir?
Yes, this is Member Weir. Can everybody hear me?
We can.
Okay. So Janine and I worked on this along with Allison. We're trying to project a 5-year plan here. So I took care of the revenues. I'll let Janine talk about the operations and the expenditures, and Allison also. But as far as the revenues go, I am applying the reduction formula that the county has worked out with our outside sales tax consultant, HDL. And I mentioned earlier in my report, it looks to be about 15% after the second year reduction. So I've incorporated those reductions into the revenue projections that we originally had for the measure. And you can see those on, looks like page 1 of this 5-year plan down at the bottom of the page. That is for the facilities only, 75% of the money. At the end of the 5-year period is projected now to be $29,228,000. So that's a starting point for whether or not we can afford to build facilities. And then I'll let, the operations would just be the 25% remaining. Table is on the top of page 2. And that is also incorporating the reduction in sales tax proceeds towards the operational portion of the money. And that total at the end of 5 years is estimated to come out at $9,743,000. Then the bottom table on page 2 is the 6 through 10 years. We just put that in for informational purposes. As you know, the measure now drops down to 1/8 of a cent and will only generate approximately $2 million a year for years 6 through 10. So that's my presentation for the revenue portion, and I'll turn it over to Janine.
Wait. Years 6 through 10, it's in perpetuity unless it's overturned by the voters. There's no 6 through 10 here.
Okay, well, that's the table. That's what it says on the table. So.
All right, what
Okay,
was that, Tom? I'm sorry, Tom, what was that again?
There's no end to this. This once it's reduced, it continues on for perpetuity.
Right, yeah, correct, unless it's overturned by the voters.
Correct.
Right.
All right, so I'm going to move on, and I just want to clarify, we only did 10 years, and that's why Lloyd was talking. We just looked at a 10-year projection. We didn't try to look at the life of the dollars coming in, but we did ask to at least do a 10-year projection so we could at least see what we look like for the next 10 years, and that's why the graphs are that 10-year projection, and why Lloyd was addressing it that way. The next section is really just a little bit of information about mental health services. It really goes into giving you kind of an overview what facilities they are, the different types of facilities. A crisis residential treatment facility is pretty clear what it is, but when you get into the hospitalization side for psychiatric hospitalization, there really are 3 types of facilities that can be proposed to be built. So we gave you a little bit of information about there is a graph. A lot of people always wonder what the county serves. That graph really shows you where the county serves versus where in the Medi-Cal field where Beacon, a partnership health plan, serves. So looking at this, I did a quick breakdown of operational cost to look at what the CRT, if it was running, what it could cost us if it did not bill Medi-Cal till its max. And you'll see that breakdown there. These numbers are based on consultations with other counties of what it's costing them to run their CRTs, and also what some private entities are saying it costs them on a yearly basis. I just want to note that we also, this is based on, most of these projections were based on a 16-bed facility. We are not looking at a 16-bed facility, but we wanted to be conservative in our dollars to make sure that we would be within the budget we projected. So we went ahead and went with those figures. And so you'll see that breakdown. I included, once again, we included that 500,000 just as a projection of if the CRT is not operational as functional as we think, and it was going to cost Measure B some dollars, it would be a max of, we believe, of 500,000 a year, because Medi-Cal really can cover, between Medi-Cal and realignment dollars, would cover a good proportion of those costs. Doing a regional model and working with private insurance would also benefit the facility. And we would really want a vendor that would be willing to do those to really maximize the billable services, so there's less dollars coming out of Measure B's pocket. Then we looked at the psychiatric health facility. We looked at what a proposed model could look like. You can see the number of people we hospitalized in fiscal year 18-19. we really do believe that this facility should be able to operate on its own by providing billable services, and that Measure B dollars would only be used to build or renovate a facility, because they would be saving money on the cost of the, if it was a county-owned building that they renovated and Measure B bought, they would be saving money on the rent, on the facility cost monthly. So based on this, we also looked at some other models. Sonoma County is currently in the process of building a psych facility. We looked at what they're doing, what their renovation costs are, what they're projecting their operating costs are. And we did look at some other counties' costs of where they brought in insurance, where they build insurance, MHSA, Medi-Cal, all the different funding sources. So looking at that model, we still are saying that this should only cost Measure B to build or construct a facility and should not have a yearly annual operating cost for a PUF. All right, Allison?
Yes, ma'am. Okay, and for a little more information as far as the spreadsheet goes, it was got a lot of help from Knox and Lewis on this, which was great, as well as our own facilities people at the county. And what you see here in the pink and blue is the project budget for the Behavioral Health Regional Training Center, and shows what we've estimated to spend, what's been allocated, and also what we have actually spent. So we are well under, and we got some great news that we are not going to need to replace the entire septic system. So that's huge. That means maybe some new ceiling fans in our future. So that as well. The on the back page, or the second page of that, says business estimate. So we've been working on the business plan, and as far as what I've gathered as far as what it will cost to run this facility, initially with just me as the staffing person, it'll cost about $43,000 a year. Once we actually add on a staffing person, that adds another close to anywhere from 38 to 48,000 a year. So it shows just how that income will have to ramp up, and what it'll look like by year 2024, which really should be where it's at, stabilized. And I know this is just kind of Greek without actually having any information about how that would work hourly or by day. But the model that I'm looking at has people booking longer amounts of time, just having a client who will book longer amounts of time, and then we'll have trainings within that client's time frame, and then other trainings that are more sporadic throughout. So that information will be coming soon.
Thank you, Allison.
You're welcome.
I'm sorry.
I have the crisis residential and the PUF information if anyone's interested.
Oh, I'm sorry. I cut you off. I'm sorry.
That's okay.
I'm going to just jump in. I'm going to have to go. I'm sorry, I've got a hard stop. I trust whatever decisions you make, and I'll look forward to connecting with you soon. Bye.
Thank you.
Thanks, Jed.
Bye-bye.
Sorry, Allison.
That's okay. It's all right. So this is the crisis residential treatment facility that we started out with Knox and Lewis, and agreeing to a $3.3 million contract with them for design for the potential of 3 or more different buildings. So this is building number 1. And nothing else was allocated as far as construction management or construction or really any other part of finishing the project to the end of having a business or a service ready to go for people here. And so we have been working on that, figuring out the numbers for that. And Eric Fadness from Knox and Lewis and I have been working on this for probably about 2.5 months, figuring this out. And so we have the traffic grant, which is $500,000. So that pretty much just eliminated the cost of the land, and then some. We've also agreed to these monies with Naughton Lewis, which was the facility planning and programming, design engineering criteria, special consultants, and geotechnical investigation and surveying, for a total of $749,000 and change. We will end up owing that total for the design phase here, plus another estimated or expected costs for the project entire at $3,759,378. That is the entire cost, projected cost of this project, not operations, but from bare earth to opening the door and ready to go. I'm sorry.
Thank you, Al.
It just,
no, I'm sorry. Thank you. Thank you, Allison. Is that complete now? Because I can't see anything on my computer screen.
I have one more thing, and it's just that information.
Perfect.
I'm going to make this as easy as possible for a brand new, just go find some dirt up in the mountains, no hookups, nothing. Just like the most expensive project you could probably come up with as far as a PUF goes is around 20 million. If you want to do something less expensive, from what I have understood and had conversations with people about, is that we could expect to build, renovate a PUF for about $500,000 per bed. That is the going rate. That's the standard. I am told is we can expect $500,000 per bed if we're renovating.
Perfect. Thank you.
That's it.
Okay. Is Naughton Lewis on the phone ready to go?
I think they are. I think they've been waiting patiently with us this whole time.
Yeah,
right?
very patiently. Yeah. And so I'm going to omit
any.
I am going to omit any comment from the committee nor the public and allow Naughton Lewis to give their presentation.
Okay. Well, thank you. This is Eric Fadness with Naughton Lewis. And I appreciate the opportunity to present what 6 months of effort with the stakeholder committee to work through the programming design, and ultimately what we have recently completed is about 95% construction documents. So lots of time and effort has been put in by the committee and the design team to resolve the design, make decisions, and get to this point in time where we could submit to the building department. If I could share my screen, I can show you the results of the design effort. Everybody hear me?
Yes, no.
Okay,
I can hear you now.
Okay, great. Well, let me sort of restart here. To the left of the screen here, you see South Orchard Avenue. To the right is the RCS building. To the north, the primary entrance to the site or the site area. This project consists of, basically the CRT building and new access being provided from South Orchard Avenue to the site. There are actually two parcels here, so we are proposing a lot line adjustment to increase the size of the parcel here for the CRT building, and allowing space for future use to the north of the CRT, so future related use. The primary access to the site to the building is here. Parking is to the south. Utilities are located here, the corner north or the southeast corner. We're bringing to the site basically all of the electrical service. The city has been very accommodating for us and helping to help us keep pace with the design by being very responsive on electrical service. We are looking to connect to sewer in Orchard Avenue and to water service somewhere in this vicinity between the RCS building and the project site. So I'm going to share with you the next screen. Now, can everybody see a floor plan?
Yes. Yes.
Okay, great. Thank you. So this, first of all, I guess, this building is about 3,400 square feet, a little over 3,400 square feet. This has been designed for 8 beds, 4 bedrooms, 2 bathrooms. However, it can be expanded to accommodate up to 10 beds. It has the square footage to accommodate up to 10 residents. So in a short while here, take a walk through the building, but just to get you oriented, and maybe something that's really important to share with you about the layout here. This building is designed to be built with prefab modular structures. So you can kind of see regular rectangular shapes in the plan that comprise the primary prefabricated units. Those are prefabricated off-site. There's some cost savings by doing that. And there's also some speed for construction by doing that. So that's why we propose to design the building in this fashion. The remainder of the spaces would be built on site. So just like any typical home or building, the construction will be completed on site. Once the modulars are in place, the rest of the construction will occur. The roof will be put on the building and everything will be finished out. Most of the finishes will arrive to the site in the module. So, most of the modules will be completely fitted out on the inside. So it'll just be the outside that needs to be completed. We've been working with our landscape architect to provide some landscape amenities that are also program amenities for the residents. So we'll see that when you see the final product, what the landscaping will look like. Okay, I'm going to stop sharing for a moment and reshare so I can show you the model. Okay, so everybody should be looking at a 3-dimensional view. And if you're not, let me know. Some of you I know are on a phone call, so you're probably not able to view this. But this is what the building looks like. This is a walkthrough, so we'll actually move into the building here shortly. But I just want to talk about the exterior. The intent has always been to make this look like a home, a residence, the look and feel of a home. And so I think that the design reflects that. The materials are very simple. The primary material for the exterior walls is stucco, typical plaster stucco type of finish. We would also have a wood finish that you can kind of see here. That could also be a masonite. From a cost perspective, masonite may be more cost effective, just be a painted surface. But really trying to differentiate the porch area from the rest of the house. Roof material is very simple. It'd be a truss structure and with a asphalt shingle roofing system. So very, very simple. A very simple wood fence surrounding property, basically surrounding the yard, about 6 foot. So now we'll move into the building. And I'll just pause here. Just a very simple front with some what would be stone-like or applied stone, a mock stone type of a finish at the base of the porch. To the right here, you see this long structure here. That is a ramp. This facility will have to be accessible, so it have to comply with the requirements of the ADA. And so now we'll move into the building. This is the primary entrance. The first area you encounter when you enter the facility is the intake. So there is an intake office to the right here. This is where staff would interview, take in new residents, basically designed to be an office area. And you'll see a lot of windows here, glass area, so that there's a lot of visibility. And obviously that's for so that staff can observe, be aware of what's going on, and understand what's happening in the milieu of the facility. To the right here, straight ahead, is laundry facility. This has been designed for residents to be able to use. It is also an accessible space. There's storage. There's also the ability to do some an area for decontamination. If residents come to the facility with belongings that need to be decontaminated, they'd be bringing them in from the outside rather than into the facility from the front entry. And then this is the primary living space. And you can see it's a nice open area. In the center here, you see there's a room basically, and it is an area for staff that will be used for administering meds when needed. You can also see a lot of window space here, so that if staff are there, they can still observe what's happening within the living area. So there is a connection at all times for staff into the living area. Before we go on to the kitchen area, I think we'll go to one of the bedrooms. All of the bedrooms are double occupancy. So we can't have more than 2. You can have less than 2, but not more than 2. This would be a typical bedroom. You can see that nicely finished, primarily using paint, but also a wall covering that would be more durability, to protect the wall surface from damage. Been a real emphasis on ligature resistance, to avoid opportunity for and potential for suicide. So there has been a lot of decisions made about the types of fixtures that would go into this building. Make the ligature points. You'll see here some light fixtures rather than having corded type of lights. Everything would be hardwired into the wall, so light fixtures would not have cords. not to say that you won't have plugs in the walls, there will be plugs, but you know, obviously the point is to avoid having corded fixtures. Thank you. You know, really put a lot of emphasis too on daylight, being able to bring in the natural light, have that connection with the exterior. I think that's really important when you're talking about having a rehabilitative. We'll move out of this area. Just look at a bathroom. So this is basically the bathroom where residents would use on a regular basis, daily basis. Again, I'll emphasize the effort that was put into not only creating the feel of a nice feeling space, inviting, warm, comfortable, but also safe. So weed-resistant and safe types of fixtures. A shatterproof mirror that's lighted from behind, you know, rather than having fixtures on the walls that would be ligature points. Simple and accessible, you know, counter and sink, you know, typical toilet, but with ADA rails. And then also within the shower area, having a fixture that is, you know, more typical of the behavioral health facility, but you know, this would be avoiding types of shower heads and handles for controlling water that would be literature points. There's not a whole lot we can do about the handrails themselves. Those, you know, we have to have for ADA accessibility, but you know, they are designed so that there would be, you know, you would not be able to loop something around the handles. Okay, let's move back into the living space. And go down to the dining area here. So, you know, there's two sides to the living space. We passed by the main living area, which would be the more, you know, these are designed to be large enough spaces where you could have groups together, having group activity, but they're also designed to have some separation. So you can have one area that would be a little more quiet. Well, there's maybe a more loud activity on the other side. This area would be the primary area for dining. And just, you can see here, right off of the kitchen area. So let's move now to the kitchen area. Hold on there. Okay. So this is designed, obviously, to be very functional. A lot of storage, but it's also designed to be accessible. So you're going to see a lot of features here you might not see in a typical home because we have to address ADA requirements. So for instance, you see here the sink and the cabinetry around the sink is designed so that you can have wheelchair access. And you'll see under counter areas that are free for wheelchair access as well. To the left here would be the primary refrigerated and frozen foods storage. One would be a complete all refrigerator. The other one would be all freezer. So, you know, it would be large enough for the supply of food for up to 10 residents. Move in here to the left, the pantry area is large for dry goods storage. And then a 3-compartment sink and the dishwasher. So you have both, but you know, from a health concern, you know, having the proper order in which to clean dishes, keep dishes from soiled to clean. That's the purpose of the 3-compartment sink. And the cooking area over here. Again, access so that you can roll a wheelchair into the cooktop. And there's also an accessible oven to the right. Again, you can see there is plenty of storage space. And then, the entire area, again, natural light, large openings, allowing access to natural light, but also views to the exterior. You can kind of see out here, we're trying to simulate what will be the landscaping. An idea of having some orchard trees out here that not only would be, growing fruit that the residents could go and harvest, but also the view that creates for the residents. So I think that really kind of concludes, the other side here is pretty much the same as the other, bedrooms, bathroom. We also have a storage area. You can see the dining area through this door here. We could go there if you want, but it is pretty much just a storage area, and it would be the location where you would have and so forth for this facility. One final thing, we're trying to bring in as much natural light as possible, as I've said. We do have skylights in this building, so I know that is a great way to bring in natural light. It also helps with energy efficiency because the more natural light you have in the building, the less you'll rely on the lighting, the lighting that's supplied by the electricity. So anyway, I think that really concludes our walkthrough. I guess I could hand this back to Allison, I guess. I'll stop sharing my screen. Okay.
Perfect. Thank you. I want to thank you as chair for doing this, and I am so sorry that we kept you way beyond where you were expected to be.
Let me just say, I don't. I'm really happy to be here. It's been exciting to work with the county on this project, and I'm so excited that we're at this point to be able to present the design to you. So it was worth the wait.
Well, thank you very much, and thank you for the wait. I appreciate it.
No problem.
I am going to ask for public comment, and I cannot see anything because I am on my phone now. So, Lily, do we have any public comment?
Yes, we do, from Jan McGordy.
Okay, Jan, please.
Yeah, I'm not sure exactly what you need to do, but I hope that you're going to approve this because it was really jeopardized last fall.
Well, to my understanding, just correct me if I'm wrong, Allison, we need a recommendation from the committee to continue with Knock and Lewis being our contractors. I may be wording this wrong. And oh, sorry, I am going into another, I was going to do 3F2. I was going to try to do both of them together. So this is just informational. I'm sorry, Jan. The next one will be the vote. Correct, Allison? Did I lose everybody again?
No, Donna, you're here. I think Allison is not in the panelist, so hopefully she's getting back, added back in. We are asking for a recommendation to continue with the crisis residential treatment build based on the cost analysis that has been provided by Dr. Lewis and Allison, knowing what it's going to cost. We need a recommendation to the Board of Supervisors to move forward with the build and approve the proposed dollar amount for that build.
So the board.
Go ahead.
Okay, so the board asked for some data on our ability to fund it in the future, and obviously we've got some numbers here. I don't know if those have been submitted to the board, but I want to know how much of that that data was provided by Nocton Lewis. The estimate given at what was it, $773 per gross square foot, is that presuming upon it being prevailing wage? I got to tell you, my biggest concern is the data used for this conclusion mostly provided by Nocton Lewis? Because I don't believe it. I think this represents a victory of hope over experience.
Thank you, Commissioner Liberty. What I want to remind this whole committee is we only make recommendations. The whole onus is on the Board of Supervisors. We are just sitting here making recommendations. And so we still have 3F. What I saw as 3E was informational. I'm going to move to 3F, which is a motion item to continue dealing with having the contractor and having a contract administration. So in effort of making everything go quickly, we will move on to item 3F. Allison.
It looks like you lost Allison.
So I have a question. So we don't get to communicate at all about the presentation? Is that what you're saying?
Oh, no, I'm sorry. We can communicate about the presentation. I have no problem with that. Absolutely none.
I realize we piled three meetings into one session, but I think we're dealing with important issues that need to be talked about. And I have some questions about the budgets and the money. I mean, there was $500,000 of CHAFA money that was paying for the land, which was supposed to be what we owned already. And that's a question that's pretty legitimate.
Yes, it is. Absolutely.
So I don't think we rush on past it.
No, yeah.
Although I don't want to sit here any longer than any of the rest of us, but.
You know what, Commissioner Myrtle, I totally get it. And I understand exactly what you're talking about. I think the presentation was good. We do have a lot of questions. We do have a lot of things to move forward on. What I would like to, and I think, and I am probably out of policy and procedure, and right now I'm going to be honest, I would like to go to 3F, which is going to talk about construction management, CRT project, and I think we can lump the whole thing together. I could be completely wrong, but we'll just have the discussion after 3F. Is that okay with you, Commissioner Myrtle?
Well, we're building the horse and hiring contractors, and we don't even have an RFP for the operators. So we were supposed to have an RFP for the operators, supposed to be this month. That didn't happen, unless it's farther in the agenda that I didn't see.
It was earlier in the agenda.
And I will be honest, I was just reminded that we do need, sorry, my mistake, a recommendation from the floor to continue with Nocton Lewis for the floor plan of the crisis residential treatment facility. And I apologize, I'm more private than public, so I forget that we need that.
So to move forward with this without an approval from the board that says we can't, a decision from the board that says, yes, we want to go forward because we can afford to operate this, that would be just shocking to me. I mean,
well, remember that nothing happens unless we say something, and then the Board of Supervisors has every opportunity to turn it down or to vote for it. So if we don't move on anything, nothing is going to happen. I just want to remind this committee of that.
That, you know what, that does not absolve us of responsibility for making good recommendations. Our job is to make recommendations, and it's to make good ones. And
Exactly.
somebody else is gonna get the final say. That changes nothing.
You're exactly correct. But are we going to recommend that we go forward with the floor plan, or are we going to shut it down?
Without
That's what
knowing,
it comes down to.
honestly, Donna, without knowing if we're going to, if it's possible, feasible to operate this, I'd say that would be putting the cart before the horse.
That's fine. All I'm asking for, I have to do it as chair. I have to ask for a vote. It can be negative, it can be positive. It doesn't matter to me. I just need to ask for the recommendation.
No, I'd like to make a motion.
Certainly.
I'd like to make the motion that we put on hold any more money for design, any more money for construction, for contractors, until we actually understand and get the approval from the board that we can afford to operate it, that it can be afforded to be operated once built. We should not be spending, in other words, don't spend any more money working on construction until we know we can manage operations.
Wait, can I just interject? This is Mika. Isn't this the
Yes,
building?
absolutely.
Okay, aren't we talking about the building that got approved to start?
Yes, we are.
By the Board of Supervisors already. So what is it that we need from you, Allison? I keep seeing her, she's shaking her head. So can we backtrack a little bit and just I think we went off track. So Allison, can you tell us what it is you need from us? And then maybe Donna, you can figure out what order that needs to go in.
Sure. So this is the building that the Board of Supervisors okayed to design, not build. So
Okay.
so it is done being designed. It is now our time to say, yes, we approve the design, and we want that design to turn into a facility that we will use for Measure B purposes, or or we're not going to do it at all, or somewhere in between. That's where we're at.
So you're just asking that we approve the design so that we can then go and build it. I mean, the Board of Supervisors didn't approve a design and then not want us to build it.
Oh, no, because we need a budget to go along with that as well. And I did provide that, though I flew through it along with everything else I did because everybody wants to leave. So, so aside from Nocton Lewis and the Chaffa grant that has already, has been spent, we're about at 3.3 million for this facility. So we need another 3.3 to say, yes, we want to build this design and then have it built.
I'd like to hear Member Myrtle's questions.
Mark?
Sure. My questions were, we have committed to the design. We'd hoped to, before we committed and pulled the trigger on building this design, that we'd have operators in place to occupy these facilities.
Okay.
That was what my wish and thoughts were on it. Now we're pushing forward because we have the chapter deadline of being open October 2021, correct me if I'm wrong, to build these facilities. What I'm feeling anguish about and, reluctant to move forward on is that we don't clearly we have a projection of $500,000 loss to run this facility, but those are projections based on other information gathered from others, not specifically us. But we're still not sure that we have an operator to operate it unless that's already been decided upon. Mm-hmm. So that's my worry. The numbers, I believe, I'm not saying that Nocton Lewis is off on their numbers. I think they're potentially higher than what we'll get now. But it's okay to be higher than lower from their standpoint, because, you know, you look better if it's lower than what you projected. So I do agree with that. I did have some other questions about, you know, how the numbers were projected, but that's my worry, is putting us down a path that we can't come back from, and spending that money and not being able to afford to keep the building open, which I believe is what Ross is worried about as well.
Yeah, so to that point, sorry for going without raising my hand, but to that point, we actually voted to have Knock and Lewis start on design before the board started questioning whether or not we could operate. That came up in a later board meeting, and where they told staff to start putting together the budget for operations. So yes, this is true. Like we did ask them to approve, and they did approve going forward with the design, but later when they started questioning our ability to operate it, that should be looked at. I mean, this is our opportunity to look at that and say, well, wait a minute, we don't even know if we can afford an operator. We better not be spending taxpayer money on designing the building. And
I totally understand being a staunch conservative, which is going to go in the paper, I'm sure. I totally understand where both of you are coming from. Completely understand it. However, SMI will take care of most of the operational costs. There are other operational costs that will need to happen, and we all know that. We dealt with it this exact meeting, we dealt with it. We will have 1/8 of 1% of taxpayers' dollars going to that. Take it all in the big picture. Take it all in the big picture and look at it. We've already hired an architect. You want to go back on that? You guys can go back on that, but we've already hired one. We have it for 3 buildings. We have decided that the CSU is very hard to make a profit. And yes, it is a great opportunity to help people, but it is cost prohibitive. So let's look at everything and look at the big whole total picture. You have to have the building or you can't have the services. You have to have the services or you can't have the building. It's exactly the same thing. That's my point from living it. So that's all I want to get through to everybody. If that made any sense whatsoever.
Yeah.
Janine, when does the Chaffa grant expire?
So the Chaffa grant, it can expire on us at any time. So one of the things Chaffa requires is that we are meeting milestones. If we don't meet a milestone, or they feel like we're not going to complete the project by November 2021, they will pull the funding at any time. So we have to meet with them every other month and provide them with documentation that we're meeting the proposed milestones to meet the grant requirements to be open and operational by November 2021. I just want to add one real quick thing. The documentation that Allison, myself, and Lloyd put together really does give you an estimate of operational cost. You will never get an operational cost on what it's going to cost Mendocino County because we've never had one of these facilities in Mendocino County. So we cannot tell you exactly what it's going to cost Mendocino County because we've never operated one within Mendocino County. However, if you look at just thinking that a CRT could cut our hospitalization rates by 25%, and that's a low rate, right? Most of the time they say 33%. Just 25%, if we cut our hospitalization rates by 25% and the dollars we spent, and this is only Medi-Cal dollars, this is not even including private insurance dollars, Medicare, VA, that right there, 25% cost is already $775,000. If basic operating budget for a CRT is about 1.1 million. You're almost all the way there just by cutting our hospitalization costs and moving those individuals into the CRT versus the highest level of care. And that's, at that higher level, that's at higher rate. And you would have probably served more people for that rate. We will, we do have the RFP. I just want to clarify, someone said, I did mention earlier, the RFP is in the process to go out. It's already been written and it will be going out hopefully in the next couple of weeks. It's in the process for getting released for both the CRT and the PUF. The PUF is going to be a request for proposal. So those are out and are in the process and hopefully will be out in the next couple of weeks. But we have to make the decision. If we decide to hold everything, we need to know we will lose the CHAFA dollars. That's a guarantee. If we stop today and we wait, we will lose the CHAFA dollars. And remember, we're not asking about the PUF right now. We're waiting for an RFQ to come back before we make a decision on the PUF. This is specifically just to the crisis residential treatment facility that we've already been working with Nocton Lewis on.
This is Mika here. I want to say we started this project because of the deadlines of the CHAFA grant, and I think that this is just another one. So we sort of started on the premise of let's do it to keep the grant. So it feels like this is, just that same premise, just another step of it. Would that be correct, Janine?
Yes, we started this. Yes, CHAFA believes that we are moving forward with this and that's the process this is the next step and this is what we project it's going to cost to build. Of course, it could be a lot cheaper, but it's better to come in with a little bit higher than to come in cheaper and then have to come back and say, well, we underestimated. We can hope we're overestimating and it comes in lower. But this estimate is based on Allison working with our facility staff here at the county and working with Nocton Lewis to come up with the best estimate. But this is the next step to staying in line with CHAFA, to staying in line with the CHAFA requirements. This is the process we have to get to.
Okay.
In business, they call that the fallacy of sunk costs. You spent the money, consider it gone, you go forward, right? You don't chase a dollar you already spent if it doesn't make sense. You don't go back and like, oh, well, I have so much money into this already. It's like, don't think that way. Don't think that way. I mean, yes, there's a $500,000 grant that we'll lose or whatever, but you don't want to spend a dollar to chase a dime. You don't want to do that. And I think that's what we're doing here. And then we're 3 hours something into this meeting. And now we're looking to spend, commit us some millions of dollars. I don't spend.
Okay, so I'm gonna be terrible. Ross, where do you think those dollars should be spent?
I'm sorry, say that again.
Ross, where do you think those dollars should be spent? A CRT is a proven, evidence-based, proven.
I think Dr. Miller did a great job coming up with some gaps in services that can help to fill those gaps. If you look at the Kemper report, and they said you could probably reduce, with better services, reduce the need for something like a CRT by 50%. Like that does seem to be.
Oh, it wasn't a reduction for a CRT, it was a reduction for a PUF. The CRT is a reduction for the PUF.
I'll read it again. That's not my recollection.
Yeah, am I not, Dr. Miller?
Yes. Donna, you're correct. Pardon me. You are absolutely correct.
Yes,
and this is,
it is. The CRT is a deterrent to a PUF unit.
I don't know that, but I think they said services would, better services could reduce prices.
Better services includes a CRT.
Yes.
Yes.
Just because it's a building does not mean it is not a service.
Don't question that.
Is there anything else on that item? We have one more to go through. Oh, sorry, Janine, sorry, Dr. Miller, I needed a recommendation on 3E, I needed a recommendation to continue.
Yes, we are. Allison is asking for a recommendation to move forward with construction of the facility.
This is Mika. I'll make that recommendation.
I'm sorry, you can't.
Oh, I can't?
You can't because you're not part of the board. You're our manager and you rule us, but you're not part of the board.
No, this is Mika. This is Mika. Sorry, Don.
Mika, I'm sorry. I thought you were Allison. I can't see now.
I know. This is Mika. I'll make a recommendation that we continue with this process.
Okay, and do I have a second?
Actually, there was another motion. There was another motion already, right, that I made.
I'm sorry, I walked in the middle. What was your motion?
I actually made a motion to the opposite effect, saying let's not move forward with that process until we determine if we can actually afford to operate the building.
Okay, so policy and procedure says that Ross said he made a motion. Do I have a second on that motion? If I do not have a second on that motion does not go to the floor. Is that correct, Christian?
Correct. The motion would die without a second.
Thank you.
Chair Muschetti, could I please hear that motion again?
Yes, absolutely. Ross, restate your motion, please.
Well, my motion was to not move forward with further construction costs until it's determined that until we get a response from an RFP to operate it.
Chair Muschetti, could I ask a question based on that motion? You know, I'm sorry, it's been a long meeting, and so I've missed a few things, and my apologies.
Okay.
If Janine could please repeat the time frame that we're dealing with. I know we have a very specific time frame on this. If Ross gets a second on his motion and the commission votes to not move forward today, what does that do to this project?
We would lose the $500,000.
So that's the chasing the lost money that Ross was talking about earlier.
Correct.
Okay.
Does that clarify for you? Commissioner Angela?
And as I recall,
Hello?
Ross, can you hear me?
Yeah.
And Ross, you have not gotten a second on that motion?
No second.
I wonder if you revised it at all, if you would get a second?
I can only do better at this point.
Well, look, for the amount of time it's taken for this meeting, we're all doing great, that we're still sitting here and still we should just all pat ourselves on the back. Nothing has been easy today. So thank you. You know, I'm torn between really supporting the CRT, which I absolutely do. And I believe that the CRT, you know, I wish we could pull the CRT away from Measure B because it's probably the one project that, other than the training center, that we could get done that will actually make a difference. And it's unfortunate, and I really understand the business perspective that Ross is bringing to this. You know, everything in me would like to second your motion, Ross. But the reason I'm holding back is I know, you know, honestly, I have a great deal of confidence in Dr. Miller, and from what I've seen of Dr. Miller over the years, and nobody studies behavioral health and knows the science like Dr. Miller. And so, you know, when she recommends something, and I know we're focused on the money right now, I get that, and that's our job on this commission. But when she recommends something, I have never known her to be wrong.
So, you know, as much as I would like to second your motion, I have to support the decision that Dr. Miller is bringing to this commission. And I would like to see something in the middle. If there was some way to revise the motion and have something in the middle, but I'm not certain that there is.
Well, if there was any way to do it, Miss Angelo, I think you could. If there was any way to make it in the middle, I don't see one.
Yeah.
This is Mika. Can I talk for a second?
Yes.
So, Carmel was talking about how she wished it was separate from Measure B. But if you remember, the CRT has been was on the table. I mean, our QMC had a whole shovel-ready project, and we brought it back. Somehow, it got into Measure B. So now I know we wish it was outside of it, but at this point, and I get the don't chase the dollar for the dime, or however the saying goes, but we started on a certain premise, and we're just along this line, and the CRT is what will save money and is effective. So I think that's why I don't see us not doing it at this point. What have we been doing for a year and a half if we're not going to continue?
Yeah, 2.5, by the way.
Okay, 2.5. I was being gracious.
Just for ducks.
So Donna, this is Janine. I want to add something because I think maybe it meets us sort of in the middle. This is the reality. Let's say, and I'm just going to throw this out there, I don't think this will happen. But let's say we build this beautiful house that's got bedrooms to house people, and we can't find a CRT operator. Guess what? We have another option. We have an amazing board and care in our facility. That facility could be turned into a board and care, which would still be a mental health facility that would benefit our community. And operating a board and care is more cost effective than a CRT. I don't think building this facility makes it that we built something we can't use. I think we need the CRT. I think the CRT will work, and I think we have a lot of options. But I also think we always have a backup plan. We cannot get enough board and cares in this community. We only have one. We are sending 60 clients out of our community on a monthly basis that the county has to pay anywhere from $95 to $800 a day. And as a patch, it's a daily patch. We pay up to $800 a day. Imagine if you could take that facility and turn it into a Medi-Cal billable facility, the money that would save and the clients that would benefit from getting services in their own community. So I think no matter how this comes out, it's still a win-win for Measure B. It's a win-win for our community. And this facility can be one or two. It doesn't have to just be, if we, for some reason, the CRT falls through, which I don't think it will, we have a backup plan that we hadn't thought about that would actually benefit our community and our clients. And it would definitely make more than enough money to sustain itself.
But thank you, Dr. Miller, because I think some of us old school people don't want another Palace Hotel or a post office. So to not have a building that's not utilized is really still in all our memories. So I think that'll work. So I am sorry. We are on.
What's the highest?
I'm sorry.
What is the big question is, what is the highest and best use of those funds? And I don't question Dr. Miller at all that it would be nice to have that facility, and hopefully we find an operator. I don't question that. The question is, what's the highest and best use? Where is it services or is it edifices? And I think we could be better with services right now, but I'm not the mental health expert. I don't know. Maybe I'm wrong. It happened before.
Any other further comment? Because I need a recommendation on the floor to continue with 3E. I will not. Do I have a motion on the floor?
I believe Mika made a motion.
I'm sorry.
Were we done with Ross's? Ross, we didn't amend yours?
Well, no, it's your motion. You go for it. You go. You guys own it, right? You own it. You guys make the decision. You own the decision. I mean, when I say that at work, it's like I'm writing a personal check for it. So bring your checkbook. You own it.
Well, thanks for that. No pressure there, Ross.
I mean, that's when I say that to one of my employees, that's exactly what happens.
I make the motion to continue on, I forget what it is, but I make the motion to continue on.
We recommend to continue on. Yes.
I make the motion to recommend that we continue on the path that we've been going on for the CRT.
I second.
Do I have a second? I'm sorry, somebody seconded. I didn't hear it.
Ace, I second.
Ace, thank you. Call for the vote, please.
Oh, okay. Thank you.
Wait, did we do public
Hi there.
comment? We
Okay.
did?
Let's see.
Did we do
No,
public
I'm skipping
comment?
it. Oh, no, I did not do public comment. Sorry. Are there public comments?
Yes, Jan McGordy.
Oh, I'm sorry, Jan.
Yes, guys, I understand the dilemma here, but we're talking about facility money, which is 75% of the Measure B funds. And this is the best facility that we have to work with out of the three. So I don't quite understand what the issue is of not going forward, since if we don't go forward, we'll lose $500,000 and still maybe go back and do it. So, I mean, I understand public funding is really, really different from conventional funding, and there's a whole lot of hoops to jump through, but I don't know where you would have, you know, if you built a commercial building, you would have to have it completely filled with all your retail stores before you built it. It's kind of the same thing. So please, guys, let's go forward and keep the CHAPA grant and keep the CRT online. Thank you.
Thank you, Jan. Sorry, do I have any other community comment?
No.
Okay, so I have a motion on the floor with a second, correct?
Correct.
Please call for a vote.
Member Ferretta?
Hold on. Aye.
Member Angelo?
Yes.
Member Miller?
Yes.
Member Riley?
I'm going to vote yes on this item, but not without a great amount of hesitance. I don't at all argue with the need for a CRT, but this process has been incredibly frustrating. This CHAPA grant was in the county's possession for years before it suddenly became an immediate Measure B crisis. I feel like we were coerced into this decision. I agree with Ross's comments that we're now chasing this process that we're committed to under the threat of losing a $500 grant that should have been spent years ago by the county. So I'm glad that there's an alternative, that this could be used as a board and care if things go south, but I also think that we could probably get a board and care facility for a fraction of the cost. So, frustrated with the process at this point. I am going to vote yes.
Thank you. Dr. Barish?
Yes.
Member Myrtle?
Yes.
Member Weir?
Yes.
Chair Muscati?
Yes.
And let's see. And Member Liberty?
No, all alone again.
That's all right.
There's a lot of that these days.
Yeah.
All right. Have I missed anyone? I know some folks left.
Okay, so we have one last thing, and I want to thank everybody for being here. Mental health is a thankless job, and we are going to do it. We have measure 3F.
It's
which,
essentially been grandfathered into what we've just done.
kind of, but we do need to give them just a update.
Cool. Am I okay? So this is discussion, possible action regarding the recommendation for contracting with AECom, which is the construction management services company that facilities and Measure B worked on together to through the bidding process for this liminal space between design and actually having this building become turnkey. So what they have proposed to us so far, and may end up being less because they're getting started later after the fact, is that for their pre-construction, which is getting this place fully ready to construct, materials, etc., all of that, that they would charge 62, and for the contract administration, which is huge, would be the 269,676. Contract administration mostly consists of hiring everybody who would set foot on that site from the time that someone hammers the first nail until people can move in. All of the subcontractors, the concrete, the grading, I mean, absolutely, the electrical, anything that you possibly think of, these guys do it and make sure that they do this with people and firms and in a way that does not harm the county or the program. So they are they're not a nice thing to have. They're not a maybe. They are absolutely the next part in this process, and we cannot do without them. That's it. That's all I got.
Any committee comment? I can't see because I'm on my cell phone. So
this is Shannon. What is the ask here?
Oh, just that this there is the ask was that they be included just in case there was some sort of different motion made in the item above it that was less inclusive, but it wasn't, so it's pretty much moot. So I could just throw the item out. I mean, we do need to bring it to the board, but that's part of the process that you've already allowed me to do.
So this is all basically part of item 3E, and just breaking it out in case 3E didn't go through, we had to put 3F through because you can't do a damn thing without a project, without a construction manager. Is that correct?
Yes, I was covering my rear.
You were covering your hind legs.
Yes.
So I had a question.
Sure.
Yes.
The construction management firm, was that sent out in an RFP, and how many responded?
We had 5 responses, which was pretty darn great.
And this was the lowest bid?
This was the lowest bid, and they had the least bells and whistles. There were quite a few really, I mean, AECom's not a small firm, but there were quite a few firms that just had, a different person for every item that you could possibly think of. And the thing that I really liked about AECom is it's like 5 people who've been working together for the last 20 years. And that's pretty much it. So I was comfortable with that. And they're doing like everybody that we talked to about how they were to work with. said they were great communicators, you know, just really great on follow through, positive. Everything that I've experienced with them so far has been nothing but professional and you know, ready to move past any kind of logistical problem. So far, with the little I've had experience with them, I'm impressed. Mostly, they've been dealing with Doug Anderson in facilities, who did the process along with Sally Riley. So, but yeah, we got a great response.
So is this a fixed fee proposal or is it a time and material proposal? Because I see a lot of things that may not be needed in their detail that was sent in addendum 1.
I think it was time and material, but that can be changed. This was just the only thing that I really had to give you today because we didn't have the rough draft for their contract finished yet. I just got it this afternoon. So I can go through that again with Doug and make sure that that it's, you know, closer to what we're wanting instead of just kind of well, this is all the things that we could do.
Right. So the facilities couldn't handle the contract management because this isn't part of the $3 million that Knox Lewis sent it. This is an additional 10% on top of that, correct?
Yeah, Knox Lewis is architectural and design, period. That's all they do. So for every project.
No, I wasn't asking for them. I was talking about having county staff.
Oh, no, facilities does not have the bandwidth to take on a construction management project.
Could we
And
hire
just to let
a person that works as with the county to do this? Because they wouldn't be 300,000.
Just to let you know, the county technically is not involved in any of this, the county per se. So we would have to contract with the county as Measure B if we were going to do what you're saying, if that makes any sense.
I totally understand, but that's what I'm asking is if we hired a dedicated project manager and contract with the county.
Well, this is how the county does all of their projects, from what I understand, is you have an architect, then you have your construction manager. They make sure your building gets built, and that's it. And we went through the competitive process. We had 5 different people say, yes, we would like to work with you, and we chose this one.
Okay, because I'm working for the county and they're administrating their own project right now. So that's why I'm asking.
Okay.
So
that must be on a county building instead of a Measure B building.
Well, sure. So, okay.
So
we will actually, Mark. That's a good point. Miss Angelo, do you have something to say?
Yeah, we do not have the staff to do this. We just don't have the staff to do this. So if we were going to do this and hire, it would be a county position, which would mean we'd have to go through a county recruitment process. And that could take, let's say we expedited it and we were able to hire someone in a month. That would require somebody that's qualified applying. And I'm not sure what the salary would be because I think this is a little different than the positions that we currently have. So with salary, benefits, and retirement, I'm not sure what that would be. So I appreciate Mark's question, and it's a good one. I think the issue is really not, we absolutely do not have staff to do this. We have projects right now. We have a jail project, so we do have someone on that. And then the very same people that have been working on all those projects have been helping Allison at this point. So we also have a hiring freeze. So, you know, if we want to get it done, I suggest we go with a contractor. That's my suggestion.
Okay, further comment? Hello?
Donna, I want to make one more comment just regarding this, that this would be considered a county building, even though it's paid for by Measure B. It would be considered a county building. There will be maintenance on the building, and everything that we would do for this building, we would do for any other building. Right now, though, the bandwidth is just not there. So thank you.
Thank you. Mark, any further comment? Hello?
None for me, thanks.
Okay, so did we change? So we do not need an action item on this? Am I correct?
We don't.
Or do we?
I don't think we do, because
Christian?
Sorry, you're asking me if we need action on this?
Yeah, because it was
Or
sort
did
of
you have it?
taken care of. See, I'm on the sort of thing. It sort of bothers me, but
I would look a little bit more to the department and the Measure B manager. I'm not aware of action that particularly needs to happen.
okay. So it was informational, basically.
it ended up being informational, yes.
Okay, so that is it. And I really seriously want to thank the commissioners who stayed for this extra long meeting. We are actually getting things done. I appreciate it. Mental health is a 24-hour-a-day responsibility, and I appreciate your volunteerism. And to the county staff, thank you very much. I'm going to adjourn this meeting. Thank you.
Thank you.
Thank you.
Bye.
Thanks. Bye, guys.